Good afternoon, everyone, and welcome to today's wonderful afternoon with Dr. Murali. Thanks to Dr. Shaw Vilas and Teja for being in the live class. To find students face to face is a privilege for the modern teachers because all students want to tuck under the rug with the rain around. and watch on the YouTube, on the mobile, then how will teachers get inspiration to teach unless you are coming to the class? But anyway, Satyendra, Aluru, and many more who are all online, let us master every Sunday one full-scale grand test, 10 to 1 p.m. and 1 to 4, we will have all 200 questions discussed. And you try to check what is your score, improve every week. 50 Sunday full-scale grand test if you take with me. If you don't get seat, mera jimmedari. But will you be with me with the same enthusiasm, energy, and an unrelenting, incurable optimism to become the topper in the tomorrow's exam? So let's make the great beginning, doctor. Bony Labyrinth. Bony Labyrinth is a compact bone. So we have an osseous labyrinth, which is the bony labyrinth, which is made up of compact bone. And cancellous bone is what you find at the end of long bones. So there is one compact bone, one cancellous bone. You have to be very sure. And whenever there is osteoporosis, above the age of 45, when there is osteoporosis, it typically involves the cancellous bone more than the cortical, it involves more of cancellous bone than the cortical bone is what you need to remember. Cancellous bone is highly vascular. Cancellous bone has the red bone marrow. They're the 2 points you need to remember. One nerve supply will come, doctor, in the tomorrow's NEETPG exam. Gemellus superior, gemellus inferior. Do you know these muscles in the pelvic area? Inferior gemmelli, superior gemmelli, obturator internus, obturator externus, right? Quadriceps means vastus medialis, lateralis, intermedius, and rectus femoris is called quadriceps, right? And biceps, semi-tendinosus, semi-membranosus, they're all the muscles you find in the back of the thigh. So, doctor, superior gemellus is supplied by nerve to obturator internus, whose root value is L5, S1, S2. Inferior gemellus is supplied by nerve to quadratus femoris, which is supplied by L4, L5, S1. So the name says nerve to quadratus femoris. It not only supplies quadratus femoris, it also supplies inferior gemellus, is what you need to emphatically remember. Spring ligament in ankle. Tell me one human being who never had an ankle sprain. Ankle sprain and a fight with the wife or husband is some way similar. Both are painful, both are nagging, and both you can't get out for at least 3 to 4 days until it resolves. And rest is the treatment, only treatment actually for the ankle sprain. So typically spring ligament, you know that the foot has 2 longitudinal arches, medial and lateral. They are supported by plantar calcaneonavicular ligament, which is called spring ligament, and also by the tendon of the tibialis anterior and tibialis posterior muscle. They are the ones which support, is what you need to remember. And the transverse arch, what maintains the shape of the transverse arch, doctor? It is the fibularis longus, tibialis anterior, tibialis posterior tendons, which are responsible. So flat foot is a very big topic in orthopedics, right? Now, the roof of epiploic foramen. So all the boundaries of the epiploic foramen you should know. Caudate process of the liver. So if you look at the liver has so many lobes. One of the lobe is caudate lobe. Caudate lobe typically forms the roof of the epiploic foramen. And what is the importance of epiploic foramen? Through that, the bile duct, hepatic artery, portal vein, all this triad is there, no? That is very close to epiploic foramen is what you need to remember. So the duct artery vein, you remember one of the favorite question of the examiner. What is anterior? Dave. Dave is duct artery vein are there in epiploic foramen. Posterior to the epiploic foramen, imagine anterior to epiploic foramen, posterior to epiploic foramen, roof floor. So posterior to the epiploic foramen, you have inferior vena cava, is what you need to remember. Superior is the caudate lobe of the liver. And left laterally, you have gastrosplenic ligament and splenorenal ligament. So the boundaries of epiploic foramen is there, no, doctor? Sure, short MCQ. You need to be very sure about. Good to see 5 online classmates and many more to wake up from the sleep. Torus aorticus in the right atrium. What is it because of? You have a cusp of aortic valve. You know, aortic valves has got a right posterior, you have a tricuspid valve, it is. Normally, 3 cusps will be there for an aortic valve. If only 2 cusps are there, then that is called bicuspid aortic valve. Bicuspid aortic valve, few people will have congenitally. What is the risk of a bicuspid aortic valve? It leads to stenosis. Aortic stenosis is a risk with bicuspid aortic valve is what you need to remember. So the right posterior sinus and the cusp of the aortic valve are both related, and it is that right posterior coronary sinus which is leading to the formation of torus aorticus is what you need to remember. Now, equilibrium, gait, and learning induced changes in the vestibulo-ocular reflex. How are they mediated? So if you look at the cerebellum, cerebellum has got lobe, cerebellum has a vermis, which is the central part of cerebellum. Cerebellum has a close connection with your vestibular apparatus, which talks about how is the person moving and all that. That's called vestibulocerebellum. So vestibulocerebellum controls our gait, equilibrium and everything. Why a drunkard alcoholic will be swaying? Because the vestibulocerebellum, which maintains the balance, is affected, is what you need to remember. Cold regulation by which part of hypothalamus? So this is a favorite question, doctor. Hypothalamic nuclei. Hypothalamus has various nuclei. Which nuclei controls what? Which controls satiety? Which controls appetite? Which make you hungry? You are hungry not because of your stomach. You are hungry because your brain. Your brain will tell you need to be hungry. Your brain will tell enough of eating. Your brain will tell now you have to shiver. Your brain will tell you how to sweat. What is the biggest sex organ? Brain, not the penis, not the vagina. It is the brain, right? So you need to remember, posterior hypothalamus regulates conservation of the heat. When you are cold, you start shivering because posterior hypothalamus. How will you remember? Whenever you are having shivering, oh, I'm having shivering in my spine, we say. So posterior hypothalamus is shivering to produce heat. Anterior hypothalamus, oh my God, there's a lot of sweat on my face, we say. It is anterior. Anterior hypothalamus make you cool when you are hot. Posterior hypothalamus make you hot when it is too cold, is what you need to remember. Now, doctor, secondary messenger. One MCQ favorite question of the examiner. So you should remember calcitonin typically uses cyclic AMP as a secondary messenger is what you need to remember. Once more, there is a dirty list in physiology, right? So Tomorrow we'll finish antibiotic pharmacology. And from day after tomorrow, we will start general pathology, general pharmacology, and general part of the physiology, right? I'm going to give you totally around, there are about 2000 high yield facts running into around 600 paragraphs and about 50 pages of notes. I'm going to make it available for you. So please don't miss the class. And most likely by the end of August, we finish all basic sciences, anat, physio, biochem, micropharma, patho, then all the basic sciences will be over. Then we get into the clinical sciences, medicine, surgery, gynops, orthoped. That will take 2 months. Chota mota subjects in month of October. From November onwards, full every day we will solve 400-500 questions. Morning to evening we will be into question solving program only, like this. Take a test, sit for discussion. Take a test, sit for discussion. Every day also we can have a test and discussion, right? But to take the test, your fundamental 54,000 high yield facts that I give you, you should be good with, right? A lot of people think you do MCQs and come back. No, that won't help. You first strengthen the high yield facts that you need to mug. Then use MCQs to test how good you are, to recall. That way MCQs are useful. Not from MCQs towards facts is not the correct approach. I mean, my experience all these years. Right, doctor? Good to see 8 online classmates. Inform your other friends also. Every Sunday, we have a full-scale grand test and discussion. Migrating motor complexes. How does the peristalsis occur? Migrating motor complexes. Every 100 minutes, our gut will keep reminding us, cow, 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 cow. The only thing sure shot to do every day is to eat, right? That's the reason hotel industry, if you get into, you will never get losses. Similarly, hospital industry, very, very lucrative business. Hospital, hotel, medicines, and coaching. These are 4 businesses. You invest money, you will get a very good return, right? Now, motilin is produced by enterochromaffin cells. They are also called Mo cells. And typically, they are the ones which lead to the migrating motor complexes every 100 minutes in the interdigestive period. Okay? Now, doctor, erythromycin, if you take, typically you will get a reduced GI motility if you take erythromycin. Main reason is erythromycin goes and binds with motilin receptor and prevent the migrating motor complexes from forming in the gut is what you need to remember. Now, what is an appetite suppressant? Ghrelin is not an appetite suppressant. Leptin is a appetite suppressant. So you should remember, whenever you are fasting, ghrelin become produced and that stimulates appetite. Whenever you have a lot of fat increasing in your cells, leptin is produced. Leptin inhibits your food intake. Only 2 buzzwords you should remember and go for NEETPG. Because every past 6 years NEETPG question papers, if you analyze, leptin, ghrelin, and orexin. Without that, there is no question paper. Right? Sure shot. Feeding, fasting cycle, and what are the factors that decide the obesity? Today, obesity, bariatric surgeons, big business. right? Similarly, nutritionists, biggest nutritional disorder is diabetes. After 40, every second person has a diabetic. So, more than an endocrinologist, a nutritionist is earning more by becoming a counselor for the patients, right? So, ghrelin, leptin. How will you remember in tomorrow's exam? Is there any way? Leptin inhibits food intake, right? Leptin inhibits food intake. Ghrelin stimulates appetite, right? So, develop some method to remember this. One method that comes to my mind is G is what? Ghrelin is girl. Mother is a girl. Mother used to feed us. Amma annam pettu. So when you are being fed by mother means appetite should be increased. Always mother's food will make your appetite increase, no? G for girl, girl is a mother, mother will increase your appetite and feed you. Other is leptin, obviously. So now, doctor, good. Our Sunday church, 10 attendees, not bad, eh? Very good, doctor. So the main thing is just solving question paper is not enough. Sit for a discussion, know about the points that you are missing, identify what are the high yield facts that you need to keep in mind. All these analysis should go. And without discussion, there is no use of solving a full-scale mock test. Melatonin is synthesized from which amino acid, doctor? Tryptophan. So you should know this cycle very clearly. Tryptophan become 5-hydroxy tryptophan. Then that is decarboxylated. It loses a carbon dioxide and becomes serotonin. From the serotonin, acetylation becomes acetyloserotonin. That becomes melatonin. That's the reason who is the great-grandpa of serotonin? Tryptophan is the great-grandpa. Now, transamination reactions, we require pyridoxine. Once more, let me tell you, doctor, every NEET PG paper or INI CET paper, if you look, without a question on vitamins, show me one paper. That means exam is not for 200 but for 199, and that one question is going to be vitamin. Why? Vitamins in PSM, vitamins in biochemistry, vitamins in pediatrics. Everywhere vitamin. Either escape kare to udhar pakdega. Right? Like that you need to go for the exam. Preparation for exam does not require tons and tons of preparation. Smartly, you should know what examiner wants. How I can recall, reproduce in the exam. Now my question to Teja. Between dihydrofolate reductase, dihydrofolate synthase, which is inhibited by trimethoprim, which is inhibited by sulfonamide. Come on, doctor. Sulfonamide is there, trimethoprim is there, dihydrofolate reductase is there, dihydrofolate synthase is there. Come on, doctor. Very good. Dihydrofolate reductase is trimethoprim. Dihydrofolate synthase is S for sulfonamide. Trimethoprim R for reductase. Methotrexate also inhibits same dihydrofolate reductase. That is what you need to remember. And what is folinic acid? Leucovorin factor, yesterday we discussed it. What tetrahydrofolate it is? Methyl 5-methyl tetrahydrofolate is folinic acid, which we use to rescue, is what you need to remember. Suresh? So that is a transamination reaction, doctor. Be very sure. I leave all this literature in the explanatory booklet. No worries. But just peep through it. Don't worry. Because actual thing that you need to worry is only that 1500 pages that I give you. Only that suck it and then tuck it in the heart. Right? You will get the seat. So those who are online, I like to tell you that if you want 1500 pages, we will courier you, in which you get 54,000 high yield facts, from which 200 questions are going to come. Right, doctor? So what are the coenzymes for carboxylation reactions? Biotin is what you need to remember. Which vitamin has an effect on DNA? Isoretinoic acid. That's the reason what do we use in APML, acute promyelocytic leukemia? ATRA, all trans retinoic acid we give in the therapy of ATRA in APML, acute promyelocytic leukemia. What is the active form of vitamin A? Retinol. Not retinol or retinoic acid, but retinol is active form. You came during microbiology days, right? Now this question, tell me. Streptococcus pneumoniae. What is it? It is optogen sensitive, bile solubility positive, alpha hemolytic streptococci, but not bacitracin. Bacitracin not positive. So where do we use bacitracin basically? Among the beta hemolytic streptococci, you have group B, group A. Group A lead to your sore throat, rheumatic fever and all that. Group B is a part of the vaginal flora. So when a newborn baby is born, neonatal meningitis risk is there. If mother's vaginal group B streptococcus comes and infects the newborn baby. So when will that happen? If there is any sudden rupture of membranes and amniotic fluid comes out, that lead to chorioamnionitis, that can lead to the development of infection with group B. So doctor, beta hemolytic streptococci from beta hemolytic non-group A, then the bacitracin is useful. All right, doctor? And it is also used to differentiate Staphylococcus from Micrococcus. Staphylococcus is bacitracin resistant, whereas Micrococcus, its cousin, is bacitracin susceptible, is what you need to remember. So, which will not ferment mannitol? Among the Shigelle, we discussed this in our microbiology, totally 650 paragraphs and 2000 points we discussed. Notes is there, right? In that, today only you go back and review where is the mannitol fermentation, where is the lactose fermenters, where is optogen sensitivity, novobiasin sensitivity, bile solubility. There are totally around 8 to 10 tests to differentiate one gram positive from the other gram positive, gram negative from other gram negative. Be very sure. So, doctor, Shigella dysenteriae does not produce catalase and does not ferment mannitol. Sonnei is a late lactose fermenter. Flexneri produce the gas, and all except the Shigella dysenteriae ferment the mannitol. Dysenteriae does not ferment mannitol. That's the point you need to remember. Some method you need to develop, because these are all very standard questions. So some method you need to develop to remember dysenteriae does not ferment mannitol. Now, doctor, all except Shigella dysentery type 1, they all produce catalase. Understand, doctor? Now, what is the selective medium for Shigella that we use? Wilson and Blair's medium and DCA, agar. Huh? So, these are the things that we use as selective medium. Leptospirosis, what is the most important vector in India, doctor? Rhetus ratus. Gas gangrene is caused by all of them. Aseptate hyphae with asexual spores, zygomycetes. Trichophyton means, tri means all three. Skin, hair and nails. Which fluoroquinolone crosses the blood-brain barrier? Perfloxacin. Which is anti-pseudomonal cephalosporin? Come on, this you should answer correctly. Yesterday only we discussed, na? Very good. Ceftazidime. Shaw Village Jindabad. Good. I'm so happy that you answered. So once more, among the penicillins, which penicillin? Piptas. Piperacillin. Right? Then imipenem. Very good. Then ceftazidime. Then, what are all anti-pseudomonal? The list. Banco was also there. Okay. So, all the list you need to have in tips, doctor. So, remember, among cephalosporin, ceftazidime, cefepime. Yesterday he answered, Sai Krishna Reddy, cefepime. We are missing Sai Krishna Reddy. His promise is he will come today. He did not come. I am angry. Then ticarcillin, piperacillin is anti-pseudomonal. Imipenem, estrianum. Similarly, gentamicin, tobramycin, amikacin are anti-pseudomonal. And second generation fluoroquinolones are all like ciprofloxacin. They are all anti-pseudomonal. A list manasalo petkuni, parishalo. Fatafat, you should answer. Right, doctor? Terbinafine hydrochloride is antifungal. We discussed all antifungals, their mechanism, etc., in the yesterday. Which IV drug can be used in hypertensive emergency, doctor? Hydralazine, sodium nitroprusside, esmolol, they're all Air Force. They'll go and do bombing. Metoprolol is like army. Dig, military. But hydralazine, sodium nitroprusside, esmolol, everything is like Air Force. They'll go and bomb. Now, which antiarrhythmic decreases the action potential of the Purkinje fibers? Doctor, next week we are going to discuss all general pharmacology, cardiac pharmacology and all that. Antiarrhythmic classification, you have to be 100% sure. Right, doctor? Lidocaine decreases the action potential duration. So basically, how do you classify the 1 minute. First, let me show you. So how do you classify the antiarrhythmics, doctor? 1, 2, 3, 4. In the 1, you have 1A, 1B, 1C. Agreed, doc? So, you need to know that class 2 are beta blockers. Class 1 are sodium channel blockers. Class 3 are potassium channel blockers. Class 4 are calcium channel blockers. Once more, repeat with me. Class 1, sodium. Class 2, beta. Class 3, potassium. Class 4, calcium channel blockers. Lidocaine belongs to the group of class 1. Okay, doc? Class 1. So you should know, in the class 1, you have 1A, 1B, and 1C. Procainamide is what? 1A. Lidocaine and phenytoin is 1B. Flecainide, encainide is 1C. There's a lot more to discuss, but I don't want to do because Sunday is finishing all 200 questions and reminding you what you need to read. Once more, we will discuss it in the greater detail in our regular class. Right, Doc? What is an endothelin receptor antagonist? Bosentan. Bosentan. You did this correctly? This question? Good. I'm happy. RH incompatibility. Is it free antigen going and binding with a free antibody and going and depositing like an immune complex? Or an antibody going and attacking a fixed antigen on the RBC? Huh? That's called as type 2 hypersensitivity. Type 3 is immune complex mediated, is what we need to remember. Acute hemolytic transfusion reaction. I told you, no? Lewis lives, Kelly kills, and Duffy dies. These are the, other than RH factor on the RBC, you have Lewis factor, Kelly factor, Duffy factor, which are the autoantibodies that can be generated if you give repeated transfusions. Because during the transfusion of Ramaya's blood to Venkaya, we will only do ABO testing and RH testing. We don't do for Lewis, Kelly, Duffy and all. And because of that, one has, other doesn't have. If you transfuse one's blood to the other, these minor blood groups will create antibodies and that can attack the RBCs. But Lewis antibodies, we don't die. They don't cause much of hemolysis. Kelly kills. Kelly is very dangerous. If you are Kelly positive, I am Kelly negative. If you give your blood to me, my immune system develop antibody against your Kelly, and that anti-Kelly antibodies will kill my blood. And Duffy dies. Duffy Kelly doesn't survive. Right, Doc? Now, amyloidosis, which lead to cardiomyopathies, which type? Restrictive cardiomyopathy. All causes of restrictive cardiomyopathy. So we have a hypertrophic cardiomyopathy, dilated cardiomyopathy, restrictive cardiomyopathy. दारू पिए तो कैसा cardiomyopathy मिलेगा सरकार? Oh, dilated. Huh? Your heart dilates as big as the tequila Petron bottle, right? What is a very popular tequila brand? Petron. The bottle also will be Mexican tequila, will look like a globular shape. Your heart also becomes globular as you drink. So dilated cardiomyopathy, peripartum cardiomyopathies. After delivering a baby, the lady develops cardiomyopathy, peripartum cardiomyopathy. That is also dilated cardiomyopathy. So what are restrictive cardiomyopathy? Loeffler's endocarditis, endocardial fibroelastrosis, any infiltrative conditions, cardiac amyloidosis, hemochromatosis, sarcoidosis, they're all examples of restrictive cardiomyopathy is what you need to remember. Whenever blood vessel shear injury is there, tissue factor, angiotensin converting enzyme, endothelin 1, they're all basically released. So T-cell dependent tubercular antigens produce both IgG and IgA, not IgM. Earliest to be found in the serum of HIV is P24 antigenemia is more sensitive, very sensitive, right? Now comes the inevitable game called forensic medicine. Very interesting. There are totally around 1200 points in forensic medicine. I will give you 30 pages notes. Okay? And lots and lots and loads and loads of fun, but memory based. Which IPC section will say, if your wife says no, still if you push her to do sex with you, that's called intramarital rape. Right? So many challenges are there in life. Right? Which IPC section is it? So all those things, we will have a fun ride, no problem, right? So doctor, copper, mercury, lead toxicity. Very good to see 14 online classmates. Shilpa Rao, Satyendra, very good. Keep punching your answers, doctor. That will be very interesting. I'm sure you are all there in our WhatsApp group. Otherwise, you have the link below. You click and then join the group. We will be bombarding with you with questions, answers, morning, evening. We don't get sleep also. Right? We are chronic insomniacs and push you questions until the break point. Right? So please keep punching answers. Satya, Shilpa, very good. So doctor, it is the penicillamine, common not only for copper, even mercury and lead toxicity also you can use. In opioid intoxication, you get meiosis, pinpoint pupils. Then juvenile offender is a child below 18 years. Lawsuit of negligence against doctor. If your patient want to file a case on you, it should be done within 3 years. Dowry death case can be booked until how many years? 7 years. Perfect. Right? So, in a death because of the police firing, inquest is done by district magistrate. Collector in a district is a district magistrate. So, magistrate's inquest, what are the special situations where magistrate do inquest? Whenever a person dies in police custody, police inquest cannot be done. Magistrate has to do. Death because of police firing. Death in prison. Postal school. Death in psychiatric hospital. Dowry death. And if you want to do exhumation, you are suspecting and you want to once more dig back the body, then that time also magistrate inquest need to be done. A child has a running nose. Typically, the culture is being shown to you. What is the incubation period of it? It is actually pertussis, right? So, it has got a short incubation period of around 7 to 10 days is what you need to remember. A 2-month-old infant comes with this posture. What is this, doctor? It is the tetanus, typically 6 to 8 days. A 3-year-old presents with the feature which is being shown. He is also having cough, cold and swollen glands. What is the incubation period of it? It is rubella. And the incubation period is 14 to 21 days. A male student returning from a developing country develops eructation, abdominal pain. So that is a giardiasis, giardia lamblia is what you are able to see. A 4-year-old child typically has got a regional lymphadenitis with erythematous wound. So what is that which is being shown? Beta hemolytic streptococci. Then 4-year-old typically had a chronic cough, low-grade fever. This is the finding which is being shown to you. What is that you are seeing? It is typically mycoplasma pneumonia, which also lead to a typical pneumonia is what you need to remember. A 30-year-old presents and he is a homosexual male. And what is the stool sample typically showing? Once more, Giardia lavlia. So 10 children from the local nursery had watery diarrhea. And what is this organism which is being shown? It is E. coli, right? Is what you need to remember. So you need to smoothly swim. Let me tell you, out of 200 questions, if you read all the 54,000 points I am going to give you, master them, by heart the areas to be by hearted, understand the areas which you need to analyze. Within 1 hour, you can solve all 200 questions. Right? In exam hall, there is no space, no room, no scope for analysis, guessing, thinking, nothing. It's like you are put in the middle of Bahubali battle. One side something comes, another side another thing comes. Tap, 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 tap. You should keep on fighting. That you need to develop the spirit and practice every Sunday full-scale grand test with Dr. Murali Bharadwaz. 18-year-old woman, you are seeing a finding. What is this? Coagulase positive Staphylococcus aureus, which is leading to furunculosis, is what you need to remember. A 50-year-old man drinking 2 to 3 alcoholic beverages per day. He underwent upper GI endoscopy. And what do you see here, doctor? Helicobacter pylori. Yesterday we discussed triple therapy, quadruple therapy. Now tell me, what is triple therapy? Okay, omeprazole is common to both triple and quadruple, which is each given for 7 days. So then what do you have? Omeprazole? Huh? Amoxicillin? Metro. Then other one? Tetracycline, bismuth subsalicylate, and clarithromycin. So, omeprazole is common to both. It's all a common funder, doctor. MBBS is enough to practice actually. If you have love for the patient, right? Now, doctor, a 2-year-old child is pulling on her earlobe and has a temperature of 39 degrees. You are able to see the drum. So what is this caused by? It is otitis media with acute effusion. Commonly, it results from respiratory syncytial virus, is what you need to remember. Of course, Streptococcus pneumoniae, H influenza, all of them are involved. 12 hours after the banquet, stew, you know stew, famous, Kerala, appam stew, coconut stew. Abdominal cramp, diarrhea subsided 1 to 2 days later. Stool sample is showing to you. What is that? It is Clostridium perfringens, which is being shown to you. Now comes the general medicine, the dada of all the subjects. 42-year-old is being stabbed in the left chest and radiograph is presented to you. So what do you see here, doctor? This is the lung. And this entire space, no bronchovascular marking. This side you can see all the bronchovascular markings. No? Here, no bronchovascular marking. That means this is all air between parietal and visceral pleura. That means it is a pneumothorax and a tension pneumothorax. So what will you do? Needle thoracostomy is considered to be the management. 82-year-old, 15-minute history of crushing substernal pain. Troponin T level is 0.4. Elevated. And his ECG is showing. What you are saying, doctor? ST segment elevation in lead V2 and V3. Right? So, it's a case of myocardial infarction. Acute myocardial infarction is proven by the presence of ST segment elevation. Right? There is also N-STEMI. STEMI, N-STEMI. STEMI means ST elevation MI, other is called non-ST elevation MI. 29-year-old woman presents with the chief complaint of shortness of breath. And what is this ECG showing? Tall, no, what is it showing? QRS complex, which is very tall, right? So that is classical example of hypertension leading to the development of left ventricular hypertrophy. Agreed? Left ventricular hypertrophy is what you need to basically remember. Then doctor, human leukocyte HLA. Which HLA is with type 1 diabetes? HLA DR3. Once more, there is one big list. What is HLA DR3? What is HLA DR4? What is HLA B27? That list I will give you in when we discuss immunology, right? But that is another ratta batti by heart. So you need to be ready with. 53-year-old woman, 3 weeks of neck pain. And typically the triiodothyronine level is 320 and her thyroid stimulating hormone is 3. So what is the likely diagnosis given the picture? It's a thyroiditis. A thyroiditis leading to neck pain. You should think of subacute granulomatous thyroiditis. So whenever painful thyroiditis is there, what are the things that come to your mind, doctor? Painful thyroiditis. It can be subacute granulomatous thyroiditis, otherwise called de Quervain's thyroiditis, and infectious thyroiditis, or a trauma-induced thyroiditis. So patient will tell, doctor, I had a viral illness, doctor, 2-3 days ago. After that upper respiratory infection, I'm developing this severe neck pain, doctor. That is the typical description. And this inflammation will cause the destruction of thyroid follicles and it releases a lot of thyroid hormone. Transiently, hyperthyroidism features will appear. After that, the patient will go into hypothyroidism, and after some period, follicles regenerate. Then once more, they come back to euthyroid. So remember, what are the phases? Hyperthyroid followed by hypothyroid followed by euthyroid. All this will happen after a respiratory infection. A painful thyroid and thyroid inflammation will occur that will cause the follicles to release the thyroxine, that lead to hyperthyroidism. And once follicles are empty, they go into hypo. After some time, once more follicles regenerate, and that lead to euthyroidism. That is the story of de Quervain's thyroiditis is what you need to remember. A 16-year-old presents with an acute mental status changes, rapid and deep breathing, abdominal pain, vomiting. One case of diabetic ketoacidosis, if you see, you will never forget. What is the main treatment the moment you identify DKA? Hydration, 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 and giving insulin. It's a very standard regime. Sister, put saline. Sister, 15 units of insulin subcutaneous. Sister, take 50 units of insulin. Push it into that saline. Run at 50 microdrops per minute. Sister, send a sample for potassium. Right? So typically when will DKA occur, diabetic ketoacidosis? Absence of insulin. So what is the normal role of insulin on a cell? Insulin will make glucose to go inside the cell. Insulin will make potassium to go inside the cell. That is the role of insulin. But a patient of DKA, diabetic ketoacidosis, he doesn't have insulin. And he is dehydrated. If you are dehydrated, what will happen? Decreased renal plasma flow. You don't have plasma volume, no? If you are dehydrated. It decreases the renal plasma flow. That decreases the GFR. That stimulates the renin released by the juxtaglomerular cells. Increased renin will cause increased angiotensin. Increased angiotensin will cause increased aldosterone. And what is the role of aldosterone? Retention of sodium and loss of potassium into urine. So your dehydration will cause hyperaldosteronism, which will cause kaliuresis, which will cause potassium to be lost. And the amount of potassium that you have, total value of potassium, is low because you lost it into urine in decay. But normally, where is the place of potassium? Inside the cell. But because of the insulin deficiency, potassium can't go into the cell. It remains in plasma. So though the total potassium is diminished, the leftover potassium, instead of being inside the cell, it is staying in the plasma. So when a patient of DKA comes to you, his serum potassium levels typically may be normal. But that normal does not mean total body potassium is normal. Total body potassium is diminished, but amount of potassium in the plasma is normal. Such a patient, once you start insulin therapy, that little potassium that is there will run into cells, and suddenly his potassium levels fall down. So that is the reason. What will you tell to Sister Lily? Hey Lily, please send potassium. Not only sending, call the lab and find out the potassium value, right? After 2 hours, once more ask Lily, send once more potassium value, and then ask for the potassium, how much it is. Now Lily will say, doctor, potassium came down. Oh, it has come down. Then what will you tell Lily? Take 40 milliequivalents of potassium, push it into the same saline, so that you are replenishing the potassium also. So what are the 3 things you need to replenish whenever you are having a diabetic ketoacidosis? Replenish the fluid, replenish the insulin, replenish the potassium. Otherwise, patient get killed. K for I for L for liquid, fluids. Remember? So, general medicine is a fun doctor. Your DKA patient got admitted means fluid electrolyte management, DKA management. By next day morning, the patient should be drinking a cup of tea. Hi, doctor, your night duty was great, like a Titanic ship in a stormy night. I enjoyed. I'm all right. I'm going home. Now I'm a better DKA guy. So that is the whole beautiness of emergency medicine, anesthesia. If you get it, no, don't leave that. Family medicine. So these things are most enjoyable things. So, doctor, continuing our discussion. 39-year-old diabetic is brought to emergency, and after resuscitation, his blood sugar is 94. When he was brought, it was only 14. And on CT, what you found? Oral thrush, candida. So generally the rule is the candidiasis that appear in an acute diabetic ketoacidotic patient without giving any anti-candidal medication will self-resolve once you have treated their blood sugar level and insulin medication. All right, doc? A 3-year-old girl is complaining of the fever past 24 hours. Hand, foot, mouth, all of them are having lesion. So what is that? Hand, foot, mouth disease caused by Coxsackie is what you need to remember. You remember? We discussed this. Now, 8-month-old is being brought who is febrile, irritable, pupils are equally reactive to the light bilaterally. The left tympanic membrane is bulging, erythematous, immobile on pneumatic otoscopy. So, what is your diagnosis? It is a otitis media, acute otitis media. Start amoxicillin at 80 to 90 milligram per kg per day for about 10 days is considered to be the treatment. If the test is highly specific, what will happen, doctor? False positives get reduced. Highly specific. What is false positive? False positive. RMP doctor, RMP Sinu in village is a false positive fellow. Why? He did not go to medical school. So he learned what injection to give and all that. He's a false positive guy. But if the government become very specific, there will be no RMPs. But if there are no RMPs and all our doctors sitting in reading rooms and studying in cities, who is there to take care of Ellamma, Pochamma, Mallamma in the village? Nobody. That's the reason, doctor, remember. Highly specific if the test is, then the false positive results will be less. Other is highly sensitive. Suppose you said it is not 126 fasting sugar, it is only 110 fasting sugar is called as diabetes. Then what will happen? Even a guy who don't have diabetes also will become diabetic. But he is not really diabetic. That's called false negative. So, false negative. He is called false positive. So, false positives increase when sensitivity is more, and if specificity is more, false positives will decrease, is what you need to remember. 29-year-old woman is having a left lower leg pain. She jogs more than 10 kilometers. Who asked her to jog that much? So, typically, her knee, tibia, everything is fine. So, what is that called? Exertional compartment syndrome, where patient experiences the pain in the anterior lower leg because of the buildup of the pressure within the muscles of the leg is called as exertional compartment syndrome. And treatment for that is basically once more surgical fasciotomy and releasing the tight fascia which are causing that. A 23-year-old man with a new onset back pain, buttock pain, morning stiffness in his back, HLA-B27 is positive. Come on. What is your diagnosis? Ankylosing spondylitis. Good, Tej, I am proud of you. What is the pair in seronegative spondyloarthropathies? Pair. P for psoriasis, A for ankylosing spondylitis, I for inflammatory bowel disease, R for R for reactive arthritis. These are called pair, which is HLA-B27. These are all seronegative spondyloarthropathies where rheumatoid factor is negative. So ankylosing spondylitis typically presents with uveitis. 49-year-old woman presenting with the difficulty to sleep, extreme fatigue, with minimal exertion. Multiple tender points are there. Tender here, doctor. Tender here, doctor. Check. Tender here, doctor. Everywhere tender. What is your diagnosis, doctor? Fibromyalgia. Did we not discuss trigger points? Fibromyalgia is what you need to remember. You do any investigation, none of them will be positive in her. 62-year-old is diagnosed with subarachnoid hemorrhage. And the hemorrhage in the confirmed on CT. You have done surgical clipping. But 1 week later, the patient is having acute decline in mental status and an infarct on MRI. So what is the likely possibility for this? Many times we discussed this point, doctor. This is calvarium. Below that, what do you have? Dura mater. Below that, arachnoid. Below that, pia. Below that, you are having the brain. The pia tightly abuts the gyri and sulci of the brain. If there is a bleed between epiduria, between dura and calvarium, you call epidural bleed. It will be biconvex in shape. You get lucid interval. Then subdural will be crescent shaped, venous bleed, no lucid interval. Then if there is any subarachnoid bleed, the bleed is passing into the sulci. And one of the major sulcus you have is Sylvian fissure. Into that the bleed is there. So that's how you identify subarachnoid. But still it is not inside the brain. So unless it is inside the brain, you don't find infarct or a bleed or anything. But if a subarachnoid hemorrhage patient develops focal neurological deficits like hemiparesis, hemiplegia and all that, what is the only reason that can happen? When the blood vessels are passing into the brain, they pass through epidural, subdural, subarachnoid and enter into the brain. So when they are passing through the subdural space, all this bleed in this subarachnoid hemorrhage will cause the vasospasm. So what are the only two things you should remember, doctor, when you have a patient of subarachnoid hemorrhage? Hydrate, 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 hydrate. You hydrate him so much that he doesn't go into vasospasm. Give nimodipine, which is the calcium channel blocker. Calcium channel blocker and adequate hydration. They are the two things you need to do whenever the patient is having subarachnoid hemorrhage, and you need to prevent the vasospasm, which is a complication which arises typically between 3rd day to 14th day. If the vasospasm develops, patient develops paralysis. You should not let him to go into that paralytic stage, is what you need to remember. Could you understand? Good. 68-year-old man with a new onset aphasia with a left-sided homonymous hemianopia. So always aphasia is there, means which hemisphere is affected, doctor? Dominant or non-dominant? Dominant hemisphere lead to aphasia. Right-handed guy, what is the dominant hemisphere? Left. So any left hemispheric middle cerebral artery stroke, right? Left middle cerebral artery stroke, left hemispheric infarction, which is the dominant hemisphere in a right-handed individual, will lead to the development of aphasia. Agreed? So, doctor, it is a MCA stroke. So, aphasia is the feature of dominant hemisphere. Neglect is a feature of non-dominant hemisphere. Hemi-neglect. The patient will forget to wear half of his shirt. Only half the shirt will be hanging, and his wife will bring, see doctor, half he is not recognizing, and she is the better half of his life. So, hemi-neglect. Then We studied so many things, no? Blelin syndrome, Gertzmann syndrome. Neurology, you were there, no? Only revision cheyali, doctor. Crucial. Right. Now, a 76-year-old woman presents with poor sleep, decreased appetite. She is not interested in many activities which she used to enjoy earlier. But her mini mental status examination is 24. That means she doesn't have dementia. MMSE is a score to know dementia, but she doesn't have dementia. But her presenting feature is forgetfulness. Right? So what is this called as? Pseudo dementia. So when you are preparing for NEETPG, what is the word you should forget? You should never talk about depression. Ideally, in our life, we should never talk about this word. Until the last breath of life, we should be happy, maniac, impulsive, ready to do something, or in a good balance. No depression. If you are depressed, you will forget. That's called pseudo dementia. Dementia is actual dementia. Pseudo dementia is depression lead to forgetfulness. That is called pseudo dementia. All the students who go for NEETPG exam, no? I don't remember, I didn't remember, is all because of only two reasons. Pseudo dementia because they are depressed. Second is they are not doing revision. Right? That's what you need to remember. Now, doctor, a 24-year-old woman with Graves' disease, blurry vision, you have given edrophonium and improvement is there. Graves is already antibody. TSAB antibodies they are called. What are they? TSAB. Thyroid stimulating antibodies. Just like TSH comes and stimulates the thyroid, in the grave, the autoantibodies produced are called TSAB antibodies. They also act like TSH and come and stimulate the thyroid. That is the reason Graves presents with hyperthyroidism. So generally Graves is associated with other autoantibodies also. Not only thyroid stimulating antibodies, sometimes Graves also will develop myasthenia gravis. So what is the definitive treatment of myasthenia gravis, doctor? Doing thymectomy is the treatment of choice. 56-year-old man suffers from headaches. These headaches are occurring periodically. Always male headache is equal to? No. I told all headaches are female headaches. Only male headache is a band-like tightness, tension headache. That is all true. Generally, migraine or anything is all female. What is the only headache which is male headache? In which you give hyperbaric oxygen therapy. Not hyperbaric, just oxygen therapy. Come on. Only male headache. All headaches are female. Only one headache is male. It leads to periorbital pain, retroorbital pain. You feel, patient will tell, what a headache, doctor. I feel like taking the flesh out of my eye, kind of a feeling. And, Inkosari, Gattiga, cluster headache. Right, doctor? Cluster headache. Cluster headache, you give oxygen, it is male predominant, it comes in clusters, it leads to autonomic features like lacrimation, rhinorrhea and all that. Cluster headache also will lead to retroorbital pain, a pain that patient feels that something is torn out of his eye. Patient will be bouncing and falling down on the floor and crawling around. And how do you treat? Commonly, alcohol and physical stress are the precipitating factors for cluster headache. Ask the patient, stop whiskey, stop physical stress, then cluster headaches will stop. Be very sure about it. 78-year-old comes to emergency for difficulty breathing, cough, systolic crescendo, decrescendo murmur in the right upper sternal border, radiating to carotids. Pulses at tard, slow rising pulse is seen. What is your diagnosis, doctor? Just with this story. Mid-diastolic murmur is in mitral stenosis. Early diastolic murmur is in aortic regurgitation. Austin Flint murmur is in aortic regurgitation. And systolic murmur, crescendo, decrescendo, is a feature of aortic stenosis. So what this person is suffering is aortic stenosis, who developed pulmonary edema. And that is because of cardiogenic pulmonary edema. If it is a cardiogenic pulmonary edema, capillary fluid hydrostatic pressure is high. Cardiogenic pulmonary edema, whenever the left ventricle failed, left atrium pressure is high. What is draining into left atrium, doctor? Pulmonary vein. Pulmonary vein is arising from pulmonary capillaries. Pulmonary capillaries are arising from pulmonary artery. Pulmonary artery is arising from right ventricle. So what is this called as? Pulmonary capillary wedge pressure. It will be high whenever the left atrium, left side of the heart fail. So cardiogenic pulmonary edema is associated with increased pulmonary capillary wedge pressure. What is the other condition where you get pulmonary edema with a normal pulmonary capillary wedge pressure? Teja. Come on, Teja. So many times. Pulmonary hypertension. Amma. That is a differentiator. Many times we discuss it. No, not pulmonary hypertension. Come on, think about it. It's a non-cardiogenic pulmonary edema. I mean, pulmonary capillary permeability increased and fluid is going out and leading to pulmonary edema. Not because the pressure in the pulmonary capillaries is high. What is that condition? Which is a differentiator. Okay, I'll give a clue. If you have sepsis, you can get that. Lot of transfusions if you do, you will get that condition. 4-lettered acronym. A, R, D. Yes. What is that? Acute respiratory distress syndrome. Patient develops pulmonary edema. But that is not because of left ventricle failure or left atrial high pressure or a high pulmonary capillary pressure. It is because of left ventricle is good, left atrium is good, pulmonary capillaries is normal pressure, but your sepsis or hypertransfusion or pancreatitis, all this led to increased pulmonary capillary permeability. That is causing pulmonary edema. So non-cardiogenic pulmonary edema is called ARDS. Cardiogenic pulmonary edema, you get it whenever the heart fails. Understand? High PCWP is a feature of heart failure, and normal PCWP in a case of pulmonary edema is because of ARDS. Pakka. Lock kiya jaye. So many times we discuss, no, Teja. अगर तुम रॉन्ग करे तो मैं रोता हूँ पूरा रात को. Teja, please don't do that. So you're all, remember, a teacher's success depends on student success. Agreed? A doctor's success depends on patient survival. Right? You attended Dr. Murali Bharadwaz even on Sunday, even saying no to your girlfriend, though it is a very sexy, romantic weather outside, where you feel like becoming cozy, tucked inside a rug and enjoy a beautiful dream of the life. You said goodbye to all that and came to the test, attending the class, inspiring Dr. Murali to become a teacher, right? You should be successful. All right? That only happens when you are revising. Then doctor, 62-year-old man, oxygen saturation 99%. He had 12 motor vehicle accidents in the past 5 years. And typically he has got a S3 gallop, which is a sign of left ventricular failure. And he has got a body mass index 39, means obese. So what is the possibility? How will you cook all this story together? He is a fat man in the night. When he is sleeping, the palate is moving, obstructive sleep apnea. Because of that obstruction, he is building hypoxia. Hypoxia is causing pulmonary vasoconstriction. Because of that, he is developing pulmonary hypertension. That is obstructive sleep apnea. So how will this obstructive sleep apnea, guys, will be? Every time the palate is hitting and hypoxia is building, they'll immediately wake up in a sleep. They will breathe. Once more, oxygen normalizes. Once more, slowly they go into sleep. And once more, the palate will block. Once more, oxygenation decrease. Once more, they wake up. So multiple times when this obese man is waking up, interrupted by this palatal obstruction of his respiratory tract, morning when he goes to drive a truck, he's sleepy. That's why he is having how many 12 motor vehicle accidents in the past 5 years. So how do you diagnose it? Obstructive sleep apnea. Polysomnography. You will calculate his oxygen saturation levels in the night, right? And his sleep pattern. So that is how you will basically diagnose. 82-year-old man complains of dyspnea and cough, blood-tinged sputum, and the patient has a 50-year smoking history. He has got abdominal striae, moon faces, truncal fat. What is that called as? Which syndrome? Cushing. So Cushing is there, hemoptysis is there. Means what is the possibility? Hemoptysis is due to bronchogenic carcinoma. Bronchogenic carcinoma may which bronchogenic carcinoma lead to paraneoplastic syndrome of Cushing? Small cell carcinoma, right? And the X-ray of the chest is showing a central lesion. What is the importance of SSC? Means small cell carcinoma, squamous cell carcinoma are both central lesions. Adenocarcinoma is peripheral lesion. So it is a small cell carcinoma. So what is the most, and you have done the CT. CT is already showing multiple metastasis in the liver. Always remember, small cell carcinoma, by the time you diagnose only, small fellow runs very fast. So it becomes metastasis to various organs. It will go to adrenal, it will go to liver, it will go everywhere. And because of this running tendency, is there any role for surgery? Where will you cut? You have to cut the whole body. You have to take the patient to a butcher or a mutton shop and you have to cut. No role for surgery in squamous cell carcinoma. Only there is a role for chemotherapy, radiotherapy. All right? So it is a small cell carcinoma. 33-year-old man presents to the clinic with the headache, blurred vision, and there is a peptic ulcer disease. He is on omeprazole regularly. And what do you see here, doctor? You are able to see a pituitary mass, which is a prolactinoma. Pituitary tumor, peptic ulcer. Peptic ulcer means gastrinoma in the pancreas. So what is that syndrome that you remember? Multiple endocrine neoplasia. What are the three things involved in men? Type 1, P, P, P. P for pancreas with gastrinoma leading to peptic ulcer. P for pituitary tumor like prolactinoma. P for parathyroids leading to hyperparathyroidism. Pituitary adenoma, parathyroid adenoma, pancreatic gastrinoma. What is common between all the three? Pituitary is central, parathyroids are central, pancreas is central. All the three are central. That is men type 1. So what is the investigation you want to order for? Also check the parathormone whether there is any high parathormone. So 3 P's of men type 1. Parathyroid, pancreas and pituitary. A 14-month-old boy, low-grade fever and temperature is 38, periorbital bruising, proptosis of the right eye, petechiae on his legs, cervical lymphadenopathy, but no hepatomegaly, no splenomegaly, no palpable masses. And the laboratory, what is it showing? Vinyl mandelic acid elevated. So where do you see all this combination? It is a neuroblastoma. And what is those eyes called as? Raccoon's eye sign. What is that called? Raccoon's eye sign. Because of the periorbital ecchymosis, proptosis, it looks like a raccoon, right? And vinyl mandelic acid is elevated. And what is the age? 14 months. Absolutely the age where you get neuroblastoma is what you need to remember. 29-year-old woman presents with pelvic pain, and she has experienced painful periods right from the beginning of her menses days when she was 11-year-old. And the pain is sometimes present when she is not menstruating and becoming progressively worse over the years. But when she took oral contraceptives, there is some amount of improvement. And she and her husband has been trying to conceive for the past 2 years. But she is not able to. And her last menstrual period was about 4 weeks ago. And now she is having severe cramps, which is unresponsive to ibuprofen. Beta HCG is negative. And most important, pain improves with the onset of menses. Pain is aggravated whenever she has intercourse or when she is going for motion. So, dyspareunia and pain relieved with the onset of menses. What is your diagnosis? Endometriosis is what you need to remember. So how do you make a diagnosis of endometriosis? Do a diagnostic laparoscopy. And what do you get in a diagnostic laparoscopy in endometriosis? Come on, doctor. We discussed that in reproductive system review, no? Chocolate burn powder-like lesions. And in the ovary, what do you get? Endometriosis means normally endometrium is supposed to be there in the uterus. Instead of staying in uterus, it went to ovary. And there it started bleeding. That's called chocolate cyst of ovary. You remember? Chocolate cyst of ovary is what you need to remember. 62-year-old man comes to the clinic, 8 kilo weight loss for 1 month, occasional night sweats, abdominal fullness, and he was never smoked tobacco, but he was a X-ray technician. He has splenomegaly, and WBC count is 110,000. And the peripheral smear is being shown to you. Ayyo. Peripheral smear, even there also it is missing. Actually, peripherals, there, the peripheral smear is showing myeloblasts. shift to left, which is a feature of CML. So for CML, how do you diagnose? Philadelphia chromosome 922 is what you need to remember. A 72-year-old, previously healthy woman, tenderness in the ribs. WBC count is 9,000, platelet count 240,000. But bone scan is normal. That means radionuclide uptake is not increased. But what do you see? There are lytic lesions in the bone. So, doctor, and 4+ proteinuria is there. Right? Multiple myeloma. And typically, multiple myeloma is because of increased osteoclastic activity because of the production of OF. Osteoclast activating factor is what you need to remember. 22-year-old postmenopausal woman presents with a significant genital pruritus of 3 months. She has a remote history of human papilloma virus. And genital examination, what do you see, doctor? Very white colored lesion is what you are able to see, right? So what is the diagnosis in this given case? It is a possibility of vulvar carcinoma, which need to be ruled out, which also presents with significant amount of pruritus, background of HPV. They are all the risk factors for developing vulvar carcinoma. How do you get HPV? Repeated sexual intercourse with multiple partners. So 12-year-old, droop of the left side of the face, difficulty moving the left arm, and his total cholesterol level is 160. He has a maternal grandfather who has a heart attack very early at the age of 53. But this deficit lasted only for about 3 hours and he returned to baseline. And they're all the features. So what is the possibility in this 12-year-old boy? 12-year-old boy will not have, cholesterol is also not alarmingly high. So it's an ischemic attack, a stroke transiently, which can occur in sickle cell disease. 69-year-old, otherwise healthy woman presents to the clinic with shortness of breath. And JVP is elevated and edema of the lower extremities. Is it right heart failure or left heart failure we are talking? Right heart failure. Pulmonary edema is a feature of left heart failure. Bilateral pleural effusions is a feature of left heart failure. Right? So, bilateral lower extremity edema. Echo shows enlarged left ventricular end systolic and diastolic dimensions. That means heart is not able to pump adequately. Ejection fraction is 38%. Increased left ventricular wall thickness is there. Very important. So there are 2 types of failures of the heart, doctor. One is called systolic failure, other is called diastolic failure. Diastolic failure is occur when the heart cannot get filled because the ventricle is hypertrophied and became stiff. It is not ready to receive the blood from the atrium. So what is the cause of a diastolic failure, which you are able to see, a right-sided heart failure? It's a restrictive cardiomyopathy, which can be because of amyloidosis, is what you need to remember. Where do we use prazosin, doctor? Scorpion bite. So it is called Liurus quinquistriatus. And Mesobothus tumulus in India. If the scorpion knows that it has been named like this, it will be very angry, right? Then Black scorpion produces venom that is lethal. Have you seen any time scorpion bite patient? Worst death. Dying with a snake bite is relatively easier, and there is an antivenom also. Scorpion bite, patient will be conscious, and slowly that neurotoxicity will be consuming the patient. No antivenom, only supportive therapy. You give progesterone, you give clonidine, you give insulin, you pray God, you will do break the coconut and then give prasadam. That's the only thing you can do as a resident. 7-month-old, history of 3 days fever, resolved on the same day. And what is this, doctor? Roseola infantum, otherwise called sixth disease, is a common acute illness caused by human herpes virus 6, is what you need to remember. 12-month-old, 3-day history of lethargy and fever, rhinorrhea, 50% segmented neutrophils, reti count is 15%, and his CT abdomen is being shown to you. So this is called acute splenic sequestration crisis, which occur in sickle cell disease. Then 8-month-old is presenting with a 2-day history. What is this finding called? Hand-foot syndrome and dactylitis, which can occur in sickle cell disease. 1-day-old infant who had silver nitrate eye drops typically develops this. What is this called? Chemical irritation, which can occur. And 2-year-old with fever 39.3, it is typically the otitis media caused by Streptococcus pneumoniae. After a viral respiratory infection, patient's platelet count fell down, right? And developed this. What is this called as? Idiopathic thrombocytopenic purpura or immune thrombocytopenic purpura. Generally, you don't need to treat much in case of ITP. Platelet transfusions are not required unless active bleeding is there. A 4-month-old child presents with a 2-day history of intermittent irritability. And what do you see, doctor? Currant jelly stool, which is a feature of intussusception. 18-month-old boy received 5 days of amoxicillin for an ear infection. He continues to have fever. So what is this? It is a persistent otitis after 5 days of amoxicillin. Means it is resistant to Streptococcus pneumoniae. That means it is beta-lactamase positive. So what do you need to combine to the amoxicillin? Beta-lactamase inhibitor, which is clavulanic acid. Tell me, what are the 4 drugs? Cast. Sulbactam. Tazobactam. Alvibactam. Very good. I'm happy. Good. So I will keep asking you questions in the WhatsApp group to remind you. But keep answering. My whole job is at least you open the book and go back to the notes and answer. 13-year-old boy, short stature. His growth chart from age 2 to 12 years is shown in the figure. So his physical examination is normal. Tanner stage is 1. What is the likely cause? It's called constitutional delay. Constitutional delay is also called late bloomers. That means 6th class, 7th class, 8th class, 9th class, 10th class, Gopi is shorter than his sweetheart Gopika in the class. So he is not confident to propose love to Gopika. Every time when meeting at the hand wash, everywhere, he's thinking, but Gopika is taller. So 10th class summer holidays are over. Gopika is not growing anymore. Gopi grown like a tall tree. In 11th class, when they met in the NEET UG coaching program, Gopi is a handsome, tall guy who was shorter than Gopika till 10th class, but he is now like Amitabh Bachchan and Gopika is only like Jay Madhuri. So she came and proposed, wow, Gopi, you are such a tall guy. Yes, I'm a late bloomer. Maybe I was doing bad in biology, physics, chemistry. I'm sure to get top rank in NEET UG, he will tell. So that's how the romance begins. So what is constitutional delay? Late bloomers is what you need to remember. Whereas familial short stature means daddy is short, mummy is short, I'm short, all of us are short. That's the reason he will put in shadi.com. I'm 4 feet 6 inches tall, allowed to marry a 5 feet 11 inches tall girl. Because 5 feet 11 inches tall girl in shadi.com also difficult to find a groom. 4 feet 6 inches chakri also has a problem to get a bride. Better marry, right? And my grandma used to say, I mean, this grandmas tell a lot of stories, If your wife is taller than you, it's a luck. Oh, is it? Then she used to say, one more I used to spread that news in the entire school. Hey, marry a taller girl than you, then it is a luck, my grandma said. Reference is grandma. Then if hair grows in the ears of a man, he is going to be a wealthy man in life. Oh my God. What kind of funda she used to propose. And if a girl is having a mukupudka to the nose, it's always good. Because I used to ask, why grandma, why this mukupudka is very good? Yes, man. When there is any sexual intercourse, all that bad breath will be filtered by the mukupudka, and that won't cause a hypercarbia inside you. So, oh my God, so much of science of Kama Sutra used to go into old timers, right? Yeah. So, modern time, everything is abundance, doctor. That's why we are suffering the problem of abundance. Earlier day, Chitrala Hari used to come. We used to all finish the homework and then get ready and then eligibility to watch 6 songs in Chitrala Hari. From 4th song, we used to feel, 5th, 6th, over. Chitrala Hari is over. And that will come only once on Friday. Right? So we need to wait until that. And on Sunday, we used to get a program called Bala Vinodam in, like our mock test only, in the radio. So we used to switch on radio. We used to have a fight. There is one natakam. There is a notanki. So we all, me, my sister, everyone used to fight to listen that. Today, Abba, you open mobile app, YouTube has everything in the world. So we are all suffering abundance. So today, coaching programs also. 2,000 hours video, 1,000 hours video, 1 lakh question bank. What will you do with all that? Can you do? Humanly, we cannot do. But is it all needed to be reviewed and read? Not required. Notes is simple. That's the reason, doctor. Once more, I am telling you, the 1500 pages notes I give you is Bible, Quran, Gita, Adi Granth for you to become the topper in entrance. I vouch for you. So, doctor, whenever there is any short stature in your patient, how will you evaluate? Look at the upper segment of the body, lower segment of the body ratio. He is short, but proportionately short. That means there's a shortening of the trunk and shortening of the limb. Then that can be physiological or pathological. Physiological in constitutional delay and familial short stature also. Both of them, it's a proportionate dwarfism. You'll remember, right? Constitutional delay and familial short stature. Both of them are proportionate dwarfism. It can be pathological, like in growth hormone deficiency. Upper trunk, lower trunk are equally shorted. Then any chronic illness like renal disease, celiac disease, HIV, cerebral palsy, or if there is any endocrine disorder like delayed puberty, Cushing syndrome, or any psychological problem like psychological dwarfism. Don't put your kids to stress. That make them feel grow shorter. So psychologically also there is a psychological dwarfism. Thanks to our parents who did not put us in so much stress and we are able to grow tall enough. Then disproportionate means upper segment is upper segment to lower segment ratio. So you will see short limb or short body. Short limbs is a feature of achondroplasia, rickets, hypothyroidism, and skeletal dysplasias. Similarly, short body is a feature of some scoliosis, kyphosis, and all that. So this algorithm is there, no doctor? One question will come. Then one more important thing you remember. Bone age, chronological age. If the bone age is delayed, chronological age means according to your date of birth, your age. Bone age means you will take an X-ray and see how many ossification centers appeared, and based on that, you will expect certain age. So if your bone age is mildly delayed, that happens in constitutional delay and nutritional dwarfism. Bone age is significantly delayed means growth hormone deficiency and hypothyroidism. But in precocious puberty, the bone age is much advanced. That means your radiograph ossification centers will appear telling that you may be possibly 21-year-old, but actually you are only 13-year-old. So that happens in precocious puberty, because in precocious puberty, your ovary and testes are maturing early. So all that sex steroids will cause the ossification centers to appear of a 18-year-old, 19-year-old man. So advanced bone age is a feature of precocious puberty. Delayed bone age is a feature of growth hormone deficiency and hypothyroidism. Slightly delayed bone age is a feature of constitutional growth delay and nutritional dwarfism is what you have to basically remember. A 12-year-old girl presents with chest pain. She plays basketball. It is substernal associated with the dyspnea. While she is playing vigorously, and the pain and dyspnea resolve with rest. She has a 2/6 systolic vibratory murmur, which is a functional murmur. Systolic murmurs are all can be organic or functional, but diastolic murmur can only be organic. It can't be functional. So if you have anemia, children, in them systolic murmurs can be heard because of their hyperdynamic circulation. Her ECG is normal ECG. Typically, 1 is looking up, 3 is looking up, means normal axis. Right? So, what's her reason for those symptoms? It is simple asthma. ECG is normal. Chest pain is common in adolescents, is what we need to remember. What are these lesions called as? If you don't tell, I will cry. Come on. Yesterday only, we just recently finished musculoskeletal and dermatology, no? In our daily class. Come on, doctor. Very good. It is lichen planus. P, papular. P, pruritic. P, polygonal. P, purple colored. P, lichen planus. Then, what is this lesion? Bickham striae, which you find net-like white lesions are Bickham striae. So that is lichen planus is what you need to remember. Purple colored polygonal pruritic planar papules and Bickham striae is lichen planus. 23-year-old with excessive bruising on her legs for the past 6 days, and she denies previous history of any bruising, and she took ibuprofen for pain. She is not sexually active, and she has some cramping abdominal pain, but she recently had streptococcal throat infection. And what are these lesions, doctor? Erythema nodosum. What is the erythema nodosum is pathologically? Paniculitis, inflammation of subcutaneous fat tissue, is clinically called by dermatologists as erythema nodosum. So, streptococcal infection is one of the underlying cause. Even oral contraceptives, NSAIDs, sarcoidosis, TB, inflammatory bowel disease, any of them can lead to the development of erythema nodosum, is what you should remember. 32-year-old HIV positive patient exposed to herpes. His exposure occurred 3 days ago when he is playing with his niece, and he and his partner never had cold sores. What is the appropriate treatment? So, always herpes zoster, chickenpox, is a risk. So, you need to give oral acyclovir 5 times daily for 7 days and follow closely, is considered to be the treatment. 72-year-old comes to primary care physician who is showing these lesions. What are these lesions, doctor? Actinitic keratosis. You remember basal cell carcinoma, squamous cell carcinoma, actinitic keratosis, keratocanthoma? Notes, please. So, actinitic keratosis can progress to squamous cell carcinoma, is what you need to remember. 52-year-old, vaginal discomfort 15 months ago, and most recently causing itching. And there is a pain while she is having intercourse with her husband. She is otherwise very well. Her older sister recommended that, okay, you are 52-year-old, so take estrogen cream. Maybe that is the reason of menopausal drying of the vagina. Then what are the most likely diagnosis? Clinical examination is showing, what is this lesion, doctor? It's a shiny white colored lesion on the vulva. It's called lichen simplex chronicus, is what you need to remember. So, lichen sclerosis, right? So, you are able to see that whitish pink with abnormal wrinkling and a small fissure on the right, on the labia, which is typically lichen sclerosis, is what you need to remember. The dirtiest part of anesthesia is Mapleson systems. You have to remember, doctor. Higher T-piece is Mapleson E. So basically, how one did you hear any time Mapleson systems? So basically, fresh gas, doctor, patient's face. Yeah, quickly, we are done in another half an hour. Please. And we will be finishing in half an hour. Yeah, please go fast. So Mapleson A. Mapleson B means fresh glass and patient are closer. So Mapleson D, E, F, once more, while discussing anesthesia, anyway, we will discuss in detail. So Mapleson E, fresh gas comes here, patient is here, very short. So Ayer's T-piece is a Mapleson E system, is what you need to remember. Sishu, child means what? Dhritashida. Child means Sishu. Sishu mein which inhalation anesthetic? Sevoflurane. S for Sishu, child. S for Sevoflurane. Agreed, doctor? Then, which induction agent has an analgesic action? Ketamine. And remember about ketamine. Ketamine rises intracranial tension. Ketamine rises intraocular pressure. Ketamine rises the blood pressure. Ketamine lead to dissociative anesthesia. So before you go to exam, no, if I scratch you about every anesthetic 10 points, ting, 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 like a parrot, you have to answer. Huh? So there is one very famous Tyagaraja Kruti. Ramachiluka nokati techi premato pata nerpi. Rama Rama Ramayanuchu. So a parrot was brought. If you teach Rama, 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 it will tell Rama, Rama, Rama only. If you teach Are Badmash, 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 it will tell Badmash only. My job is also that. To give you 1500 pages notes, 54,000 high yield facts, and make you to repeat those facts like a parrot in the exam. But our parrots are special parrots. They listen, they read. But when it times to tell Tyagarajas, Rama Rama Ramayanuchu, when it has to the time to say Rama in the exam hall, it will become Bhima. Right? So please don't do that. Keep repeating like a parrot in the tomorrow's exam. After surgery, patient is found to have hypovolemia, tachycardia, reduced cardiac output, low BMR. What is that called? Ebb stage. Right? So, Ebb phase is characterized by lactic acidosis, hypovolemia, decreased basal metabolic rate, reduced cardiac output, and hypothermia after anesthesia. You read about Goodell stages? Anesthesia stages with ether, they're called Goodell stages. Goodell stages. Right? Mallampatti classification to know the adequacy of intubation. There's a very fat ustad comes to you from old city. Right? He just stabbed a couple of guys and stabbed himself also. Ustad Ali Malik came to you, the gangster. You have to intubate. You can't see anything. His tongue is like a Mount Abu. And where will you pass the blade? So, but if the same Malik comes for an elective surgery, pre-anesthetic only, you need to evaluate whether it is easy or not. Otherwise, you need to order for a what is that fine intubation method? What will you order if the Mallampatti is very low? How will you do? We'll discuss that in anesthesia. So, sudden increase in end tracheal carbon dioxide level, why will it occur during anesthesia? If there is any shivering or hyperthyroidism or end tidal carbon dioxide, malignant hyperthermia, it will increase. Shall we take a 5-minute break? All right, doctor. How much time we took? Amma, 2 hours, sir. Second, you have energy or you want to run away? Pakka, want to fight 200? Right? Very good. So we have 14 online students, doctor. I am so happy, thankful to all of our wonderful online classmates. Remember, we have 3 things to offer you. After the session is over, every day we have 3 to 4 hour session. We remove the video, archive it into Score app and also on the onlinembbs.com. Second, we discussed totally 54,000 high yield facts and give you 1500 pages of notes couriered to your home if you're not from Hyderabad. But if you are from Hyderabad, come to Hyderabad, to our learning center, enjoy a live class like our friend Shaw Veles, right? And every day we have 3 to 4 hour session, right? If you're not from, no problem. You can still watch on the YouTube. Then third thing, mock tests. 50 full-scale grand tests like this. You can play it on the Score app and with a chatbot tutor. So that is what we try to achieve, doctor. And please stay online. We'll finish the next 100 questions discussion also. Welcome back to the discussion, doctor. 84-year-old underwent radical prostatectomy. So, he lives by himself, performs all his daily activities normally. He underwent the surgical procedure uneventfully. But when he is in ICCU, surgical ICCU, after surgery, suddenly he got agitated, confused, cannot give full attention to the hospital staff to their questions. He doesn't remember his name. He does not believe that he is in hospital. Classical of delirium. Classical of delirium. 38-year-old, past 9 months, she has felt constantly nervous. Her temperature is 100.1. Blood pressure is 128/72. Then she denies any flight of ideas, pressured speech, or increased goal-directed activity. She has a proximal muscle weakness and hyperactive reflexes. So, a lot of times systemic conditions present like psychiatric conditions. One of the systemic conditions that presents with anxiety and all these things is hyperthyroidism. So that is the reason this is not a primary psychiatric condition, but due to hyperthyroidism. So give an antithyroid like methimazole is what you need to remember. Always in anxiety disorders, one should always rule out whether the patient is having hyperthyroidism. Especially earlier, if they don't have a history of anxiety disorder, you need to consider. 18-month-old girl appears drowsy. Her BP is 90/60, pulse is 54. And multiple circular scars on the forearm and contusions of varying ages. Recent contusion, old contusion, different contusions on the lower leg. 18-month-old, 1.5-year-old. What is the most likely possibility? Child abuse. So, look for the bilateral retinal hemorrhages in a given case of child abuse is what you need to remember. 34-year-old man was apprehended by police 4 weeks ago because he is running across the road and he is saying that, okay, I am under the weather if you get my drift. And he is also thinking that he will soon replace the Prime Minister of Britain. Instead of Sunak, he will become. And he will be the next Pope of the Vatican Church, he thinks. They are called grandiosity, hallucinations of grandiosity, which is the feature of a mania. That is bipolar disorder with psychotic features. Up to 50% of patients with bipolar disorder will show psychotic features. A medical college faculty has Asperger disorder. He appears to stare through the people when talking to them, as if he were talking to someone far behind them. Yeah, a lot of professors used to scare us, right? So this professor has unusual poor social functioning. He appears very clumsy, constantly dropping the books and materials. What happens in Asperger disease? Poor motor coordination. So, autism, ADHD, Asperger disease syndrome, Rett syndrome. There are about 1,500 points in psychiatry for you to crack the 5 marks in the psychiatry, right? I'm going to give you a 30 pages notes, 30 to 40 pages notes, which you have to master. So, main thing about Asperger disorder is lack of eye contact, a paucity in facial expression, and a flat, emotionless tone of voice. Yeah, a lot of our professors, HODs used to have this, right? And absent sense of humor, non-verbal communication, repetitive routines or rituals. Wear apron, otherwise get out of the ward. Nowadays, still apron rule is there. Consultants, we are not wearing apron because apron is the source of spread of infection to the patient. So, yeah. Now, which is not a feature of pulmonary TB in late HIV, doctor, cavitation is not found. But miliary TB, mediastinal lymphadenopathy, diffuse interstitial nephritis, infiltrates, they're all the features of TB in HIV. Polygamic lung fields. Favorite question of the examiner, doctor. Which cyanotic heart disease has? So basically remember, 4 T's you need to remember about cyanotic heart disease. T for tetralogy of Fellow. T for Truncus Arteriosis. T for tricuspid atresia. T for total anomalous pulmonary venous circulation. Repeat with me. T for TOF. T for Truncus Arteriosis. T for tricuspid atresia. T for total anomalous pulmonary venous circulation. Now, what does the TOF include? TOF means there is a ventricular septal defect. From the right ventricle, pulmonary artery normally arise, no? Here you have pulmonary stenosis. Then there is a overriding aorta which opened the mouth into both left and right ventricle. And because of this pulmonary stenosis, right ventricle is hypertrophy. Summarize. What are the top features? VSD, PS, right ventricular hypertrophy, overriding aorta. When do you get cyanotic heart disease? If the left meets right or right meets left? Very good. Very good. Bad meets good, boys. Right? Bad meets good, boys. Cyanosis will occur. So, in TOF, the right ventricular bad blood, pulmonary stenosis is very tight. It is not letting it to go into pulmonary artery. So what it will be tempted to go to? Overriding aorta, which is getting the blood also from left ventricle. So left ventricle's good blood and right ventricle's bad blood mix it together. That lead to cyanosis in TOF. Agreed? Then comes tricuspid atresia. Tricuspid atresia. What happens in tricuspid atresia? Where is tricuspid valve? Between right atrium and right ventricle. This is pulmonary artery. Atresia means complete occlusion, narrowing down. So automatically that raises the pressure in right atrium. And that will drive the right atrial blood into left atrium through the patent ASD. So right met left, bad. That's the reason tricuspid atresia is also cyanosis. Then you have Truncus Arteriosis. That means what? The aorta and pulmonary normally are separated by formation of a septum. But both of them are not separated. So you built a Truncus Arteriosis. There the complete mixing is occurring. Then total anomalous pulmonary venous circulation means what? Normally pulmonary vein bringing the good blood is joining what? Left atrium. But instead what it is doing? It is joining right atrium, total anomalous pulmonary venous circulation, right? So later, these patients will only survive if they have an ASD available. Through that, once more, the right atrial blood go back to left atrium. So pulmonary vein brings blood into right atrium, superior vena cava, inferior vena cava also in right atrium, and they won't survive. Obviously, left atrium should receive blood, no? From the pulmonary vein. It can't be empty without doing anything. So left atrium will tell to right atrium, hey, my pulmonary vein by mistake came to you, right atrium. Not only your SVC, IVC, please give me back my blood now. Then right atrium will tell, how will I give you the blood? Tuck, tuck, like two prisoners in the jail. Tuck, 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 tuck. Then they will make a hole in the ASD, atrial septal defect. And through that, the blood will pass from right to left, and right is bad to left good is cyanosis. Summarize, doctor. 4 T's you need to remember when you talk cyanotic heart disease. T for the top, T for the tricuspid atresia, T for the Truncus Arteriosus, T for the total anomalous pulmonary venous circulation. So which T is your patient having? How do you know? How do you know which T your patient is having? You ask the X-ray, look at the lung field. Suppose if it is tetralogy of Fallot, what do you have? Pulmonic stenosis. Amount of blood entering into pulmonary artery is diminished. So what do you get? Oligemic lung field in which T? Top. Then second, tricuspid atresia. Right atrial blood is not come to right ventricle only. That is the reason what will happen? Pulmonary blood flow is diminished. So one more oligemia is TA, tricuspid atresia. Whereas Truncus arteriosus or total anomalous pulmonary venous circulation, if you take, what is happening in total anomalous pulmonary venous circulation? Right atrium is receiving the regular blood and also the blood coming through pulmonary vein. So more blood will go into right ventricle and more blood in the lungs. Pulmonary plethora is seen in Truncus arteriosus and total anomalous pulmonary venous circulation. The 2 T's. Pulmonary oligemia is seen in 2 T's. Tetralogy of Fallot and tricuspid atresia. Will you remember? Pakka. Dil se. Good. Then Dr. Murali's soul will be heaving happily in graveyard. Huh? So, bird-beak appearance, biscuit cushion, achalasia cardia. Mosaic appearance of the bones is seen in Paget's. In Paget's, there is one very good sign called, very important sign called blade of grass. Can you see the blade of grass here? See, this is the blade of grass, doctor. Gaddi pocha. Huh? What is the famous statement of N.T. Ramarao? You give me a grass also, I can make it CM. Right? So, blade of grass lesion. Why does it happen? Whenever Paget's is there, initially there is an osteolytic phase followed by osteoblastic phase. During that osteolytic phase, there is a lot of resorption of the bone. And that leaves what is called, that lysis lead to blade of grass sign. Then what is this called? This is called the picture frame. Picture frame lagate na? To the elderly people who died. So that osteoblastic phase, the thick osteoblastic feature will lead to picture frame sign. Photo. Then how is this looking like? This is looking like cotton wool in the Paget's disease. It is also called osteoporosis circumscripta in Paget's disease. And what is this? Iliopectineal line became very white. So that is called sclerotic iliopectineal line, otherwise called the brim sign. It's the brim, no? Through which baby comes out. Pelvic brim. And what is this? This is a normal femoral head with a good acetabular space. Here, there is a dissolution and it is protruding into. Protrusio acetabuli is a feature of Paget's disease. And what is this? This looks like an ivory object. Ivory, enugu dantam. Right? Ivory vertebra is a feature of Paget's disease. Do you remember all this? I have put in all in the WhatsApp group. So you are sure no WhatsApp group audio questions are fine. Pakka, continue. Good. Because if you look at text, you won't get motivation. If I'm shouting, no, what is the answer? Come on, tell me. Then you will feel, oh, poor man, old man is shouting. Huh? Let me try an answer. At least that motivation you'll get. So how do you investigate a gallstone? First thing is you have to do ultrasound. First rib fracture carries 30% mortality. When will you do thoracotomy in a blunt trauma to the chest? There are some indications. If the amount of blood is 1.5 liter, continuing loss more than 200 ml, all this. I leave the literature for you in the printout given to you. So, what is the criteria for the emergency admission in burns unit? If there is any inhalational injury or if he required fluid resuscitation, requires surgery, or hand, face, feet, perineum, if any burns are there, admit them. I'll leave the literature for you. Cleft lip, when will you do? 5 to 6 months. Cleft palate, you will do 6 to 18 months. Then what is the rule of 10 before you operate a cleft lip baby? Cleft lip can be operated at 10 for 10 weeks of age, at least 10 pounds of weight, which means 5 kgs. 1 pound is half kg. And 10 gram percentage of hemoglobin. Worst prognosis in head and neck tumors is for adenoid cystic carcinoma of the salivary gland. Chylothorax in children often is post-surgery. Most common site for lymphangiosarcoma is post-mastectomy. That lymphedema, if you irradiate it, then that lead to lymphangiosarcoma. When do you call morbid obesity? More than 40 kg per meter square. Where will you find spleniculi? Typically, splenic hilum is the location where lot of small splenic tissue can be found, called spleniculi. What is the most common primary tumor of spleen, doctor? Lymphoma. And most common benign is hemangioma. Delorme operation is for rectal prolapse. So, in the score app, once you answer a question, it will check whether you are right or wrong. If you are wrong, it will say, shall I show you the explanation immediately while you are taking mock test only. Then after every subject, it will tell what is the score. Like Rummy, you are playing cards. You want to know what is the score. So Rummy score. So doing a mock test 200 questions, you feel bored. But doing with a chatbot on the score app, fun. When you do right, it will say, wow. Then if you do wrong, it will say, oh, and all that. Right, doctor? And suppose in the middle, your girlfriend said, honey, today is Sunday, let's go out for a breakfast, go with her. Then you come back and you can continue the test. Right? There are all the good things about the SCORE app. Yeah. So, Dr. Charles Phillips procedure is done for recurrent small bowel obstruction. So, what is a very common cause of the small bowel obstruction, doctor? Post-operative adhesions. Suppose earlier a surgeon has done a laparotomy. Post-operatively, there will be a lot of adhesions and lead to development of intestinal obstruction repeatedly. And you do Charles Phillips, where the bowel is placed in an orderly fashion in a long synthetic sutures and passed through the mesentery of the plicated bowel. That is called Charles Phillips. Few people will have more tendency to form post-operative adhesions. Few people will not form. Right? So in ulcerative colitis, how do you make diagnosis of a toxic dilatation of colon? More than 6 centimeters is toxic dilatation. So this is how you get a typical toxic megacolon. Typically looks like with a dilated bowel. What are the most common site for colonic angiodysplasia? Ascending colon is the most common location. Angiodysplasias bleed, and that lead to development of hematochezia, frank blood in the stool. And you do colonoscopy, you may miss. So you do radionuclide scanning in order to identify the angiodysplastic lesions. Right? Then most common location for solitary ulcer is rectal ulcer. Anterior wall of the rectum. The hard stool will be hitting it hard and leading to solitary rectal ulcer. Spidgelian hernia, have you heard of this? A hernia that occurs at the level of arcuate line. Once more, abdominal wall anatomy is a big Pandora box, which we don't study in MBBS properly. So, doctor, when do you want to remove an adrenal adenoma? Adrenal adenoma is also called Conn syndrome. So once it is more than 4 centimeters, large means 4 to 6 centimeters, you will remove. Because if the size is 4 to 6 centimeters, it means it is no more adenoma but malignancy. And suppose if you do CT, the CT attenuation value is more than 10 Hounsfield units, that also is suggestive of malignancy. Now, doctor, renal TB, what is the earliest symptom? I had been listening since my final year MBBS, our professor's favorite question. Abbailo, we used to have one professor called Ashok Reddy. Very nice teacher, very kind-hearted. I am Kurala Ocharaya. First sign of early symptom of renal TB is what? Similarly, lipoma, clinical presentation in the ward used to be an excitement to some teachers, influences throughout life, we remember them, right? So, renal TB, urinary frequency is the earliest symptom. Posterior urethral valve, most commonly will be distal to verumontanum. The other day we discussed, bulbar urethra, prostatic urethra, membranous urethra, all these things. Verumontanum comes there. Peyronie disease is the bowing of the penis during the erection because of a fibrous plaque. Testicular teratoma, how do you treat? Orchidectomy with retroperitoneal lymph node dissection is the treatment. So you should know seminoma treatment versus non-seminomatous tumors. Like testicular teratoma, how do you treat is a favorite question. So here you can see the lateral radiograph. So what is that you are seeing, doctor? This is a Bogdalex hernia, diaphragmatic hernia, where the diaphragmatic contents come into the thorax. So it is a posterolateral aspect of the diaphragm. If you take a lateral film, this is the diaphragm. So posterior aspect of the diaphragm, there is a herniation of the abdominal content into the thorax is happening in borderline. This requires emergency repair. Whereas foramen of Morgagni is seen in adulthood, incidental finding, it appears like an anteromediastinal mass and it can lead to acute respiratory distress rarely in infants. 54-year-old salesman in Bangalore is having severe vomiting, retching spell, sharp substernal pain, arrived in emergency, chest radiography showing a lot of air, pneumomediastinum. In the mediastinum, there is a lot of air. So, severe retching lead to esophageal rupture, leading to pneumomediastinum. What is that called? Boyer-Harvey syndrome. Immediately you need to do thoracotomy for that. So what do you see here? Coin lesion in the lung. So about the coin lesion, you need to know you have to resect it and look at its histology, whether it is a malignant or a benign. That is the story of coin lesions. So what do you see here, doctor? This is rat tail appearance of achalasia cardia with a dilated esophagus because of the lack of relaxation of lower esophageal sphincter. That's the reason there is a higher than normal in these people. There is a higher than normal incidence of esophageal carcinoma is what you need to remember. 26-year-old woman from Warangal admitted with the back pain, hypotension, CT scan is obtained. And what do you see here, doctor? Aortic aneurysm which ruptured and dissecting, blood is dissecting into the tunica media is what you are able to see. So obviously when there is a dissecting aortic aneurysm, the lumen become narrowed and the blood flow to the branches of the aorta get diminished. One of the branches, mesenteric artery. That's the reason there is a great risk of developing ischemia of the left colon is what you need to remember. Now, whenever arterial insufficiency is there, which one of these symptoms conservative management is needed instead of a reconstructive arterial surgery? Claudication. That is, when you walk a little while, you will get pain. Right? So the main problem whenever there is any thromboangiitis, obliterans, or arterial occlusive disease due to atherosclerosis, limb loss. So what are the signs of an impending loss of the limb and gangrene? Any ulceration, ischemic neuropathy, nocturnal foot pain. Those are the signs of advanced disease which you require to aggressively treat. A 21-year-old medical student from Bijapur Medical College, right there. What happened to her? What was the question number? 130? Admitted to the emergency from the room following a motorcycle accident. There is a lucid interval. There's a dilatation of left pupil. And what is this appearance, doctor? Biconvex hematoma, which is epidural hematoma, which is arterial. Whereas if you get like this, no, crescentric shaped bleed, then that is subdural, which is venous bleed in the elderly people. No history of trauma, no lucid interval. 18-year-old came to emergency. He has intact cranial nerves. He is able to move his shoulders, but he cannot move his arm or legs. He is flaccid and and has a sensory level at C5. So always in spinal trauma, if you want to decrease the chance of further worsening of the spinal injury, you will give intravenous methylprednisolone on the arrival of the patient. Huntington's disease is autosomal dominant. This is that half of the offsprings will be at the risk of developing the Huntington's. Tension band wiring, where do you do? Patellar fracture, olecranon fracture, medial malleolus fracture, Norton Colles fracture. Hill-Sachs lesion means? So Hill-Sachs Bankert. So whenever any shoulder dislocation is there, it will cause the stripping of the glenoid labrum, and the head comes to lie in front of the scapular neck in the pouch. And a Bankert is a antero-inferior lesion, and Hill-Sachs is a posterior-superior lesion is Hill-Sachs, posterolateral. So how will you remember? Hill is on the top. Hill is on the top. Then automatically you'll remember bank is bottom. So, but this is antero-inferior, not just inferior. This is antero-inferior, that is posterior, not superior, lateral. That is called NEETPG entrance. Avascular necrosis most commonly is because of the femoral head is due to intracapsular fracture. And most of the femoral neck fractures are intracapsular. So intracapsular, extracapsular, how do you differentiate? We'll discuss in orthopedics. Congenital knee dislocation, then the knee will be in which position? Hyperextension. Primary osteoarthritis of knee joint, what does it lead to? The other day we discussed varus. Valgus means it will be like this. This is varus. So genu-varus is the deformity you see in the osteoarthritic people when they are walking, elderly people. So it will be adduction, external rotation of the hip is the varus of the knee, and flexion, adduction, external rotation of the hip. That is the deformity that you see in osteoarthritis. Most common ligament injured in ankle sprain is anterior talofibula. Okay? Giant cell tumor, what is the other name for that? Osteoclastoma. So it is a lytic lesion. It is a epiphyseal origin. So it is an epiphysis, bones around the knee, lower end of the radius, and that soap bubble appearance. They're all the classical features. There is no calcification unlike chondrosarcoma. No reactive sclerosis around the tumor. Tumor usually reaches to but does not enter the adjacent bone. Blue sclera is a feature of osteogenesis imperfecta. Sequestrum means a piece of dead bone. 11-year-old boy comes. What do you see here, doctor? All this sundray appearance, which is a feature of osteosarcoma. Visible spectrum of light is between 400 to 700. You can remember, 800 is the highest mark in NEETPG. 400 is 50% score. Between 400 to 700 people, 36,000 people are there out of 1,86,000 who took the entrance. 1,50,000 people got below 400. You require 100 Murali Bharadwazes to cry morning to evening to make you reach above 400. Yeah. So somebody was saying, आपके जमाने में पीजी एंट्रेंस कोचिंग गुरु आपकी है, नो कंपटीशन. आज तो सब कुछ है तो भी कंपटीशन भी उतना ही है. 23 years ago when I started coaching, the Usmania Gandhi students used to be more knowledgeable than me. उनको पढ़ाना बोले तो मैं बहुत पढ़ के आना. आजकल का तो पार्किंसोनिज्म, वुल्फ पार्किंसोनिज्म का बीच में भी फर्क नहीं पड़ रहा है. Right? I don't know what's the reason, but unfortunately, slowly our standard, we are also becoming like engineering students. Read for 10-15 days and pass the exam. Passing exam, even in our days, passing exam is a big fiasco. So that's the point. It doesn't matter, doctor. It really doesn't matter. It doesn't matter what you read. You might have wasted all 4.5 years, right? I am a disco dancer. You have not studied at all in 4.5 years. Internship also, you screwed it up and said, oh, come on, who will go and proxy attendance? Still you come to me. 6 months you promise that you will sit with me. I will hold your hand and make you topper. 56-year-old was my MS orthopedics he did. I asked, what is the use at this age? You are preparing for entrance exam. You yourself is in an osteoporotic age. And those books which you read are no more relevant to the modern books. No, sir, I should make it, sir. This is the mission of my life, sir. I could never accomplish. But I produced 3 children and my son, my elder son also got married. But now I'm free, sir. I want to do PG. He used to every day come and sit in the front row. I used to enjoy, right? So he got 7th or 8th position in service quota. So when he joined, it was like 7-star to me, right? So it really doesn't matter what was your background. 6 months, if you strictly sit, 54,000 points and 1,500 pages notes that I give to review. Every day, 3 to 4 hours, like a maniac like me, you also sit and study with me. In the WhatsApp, midnight, 3 o'clock also, I'll be punching the questions. Answer that and then take the things in a spirit of fight. Take the mock test, attend the discussion. You are going to be my topper, right? Perseverance, doctor, everything perseverance. The great men are born with a consciousness that they are meant to become great. You look Shankaracharya or anybody, they all became. Greatness is a personal perception, consciousness that yes, I have become to become a cardiothoracic surgeon. I have born to become a neurosurgeon. I'm born to become a neurologist. It's not an incidental thing. You need to be conscious to perceive that I am born to be a NEETPG topper. Who is going to bloody hell stop me from? Because the people who top the entrance every year, they are not any super brains. They are conscious brains. In the dream, they want to be a top nephrologist. In the dream, they are thinking to top. So once you do, biggest breaks to our progress is who, doctor? Who is the biggest progress? You want to become great. Who is the break? Who will put brakes? We ourselves will put a brake. There is some subconscious level which will be telling, what will you read? Anyway, you will forget. Anyway, you will forget. Kill that fellow. Right? Bring Dr. Murali Bharadwaz's voice into your brain. You are born to be topper. Then we will achieve the great stride in our life, doctor. So it's all purely willpower. I'm just checking how much willpower is still there with you. 2 hours 50 minutes, you're still sitting. Are you sure? Or remaining you'll study? Huh? We'll finish your study. 50 only, na? We finish, we get that orgasm. Yeah, we did that. So visible spectrum of light is 400 to 700. Infrared means longer than 760. Ultraviolet means shorter than 380. What is the radius of curvature of the cornea? 7.8 mm. No intelligence needed. Total refractory power, 59 diopters. Refractive index of cornea, 1.38. Aqueous humor, 1.33. Lens is 1.4. White rays humor is 1.34. You have to bite and remember these numbers. Angular conjunctivitis is Moraxella. The other day I put one image of, there is along the angle of the eye, there is a development of conjunctival inflammation, which is angular conjunctivitis. So, whenever congenital cataract is there, you need to operate within 6 weeks after birth. Ophthalmology is a great branch. Sarvendriyanam nayanam pradhanam. Right? A lot of times we think only medicine, surgery are great. No. Ophthalmology. Because congenital cataracts, strabismus surgeries, retinal surgeries, oh, it's a big ocean of that. So to avoid amblyopia, congenital cataract should be operated within 6 weeks. See, God gave 2 beautiful eyes, doctor. A newborn baby, congenitally, there is a cataract. Right? So then what is happening? Only from one eye light is reaching retina, the other it is not reaching. So the growing brain of the newborn, the visual cortical area, it will suppress the existence of that cataract eye. Later on, after 6 weeks, even if you repair that cataract also, visual cortex only has a map of your normal eye. Abnormal eye, it doesn't have a map. That's the reason you have to run and get the congenital cataract operated within the age of 6 weeks is what you need to remember. Rosette-shaped cataract, trauma. Different types of cataracts are there. You don't know. The ones for oil drop cataract. So, Christmas tree type of cataract. Batti maro, ratta maro. Then keratic precipitates in antechamber. Whenever you have uveitis and iridocyclitis. C-fan like retina. Sickle cell disease. So this is called what, doctor? C-fan like retina. This type of things will come. See, when you do angiogram, you are able to see the C-fan. No, this is typical C-fan. Life is very beautiful, doctor. Go to Maldives, jump into ocean, go for a scuba diving. Everybody in lifetime should do at least one experience of scuba diving. When you go underneath the water, no, such a beautiful fauna and flora, right? It's not always NEETPG. Oh my God, there's a beautiful life out over there. Laid-in squint is also called heterophoria. Phorias and hyperphoria, exophoria, isophoria. We will read all that squint topic in shortly. Now, anti-glaucoma drug, which is long-acting and used only once daily, is timolol. LASIK may we use excimer laser. Noise-induced hearing loss occur between 2000 to 4000. Now, doctor, one of the favorite questions of the examiner. What is that frequency of hearing loss in various causes of hearing loss? Favorite question. Noise-induced hearing loss, 2000 to 4000. Drug-induced Ototoxicity leading to deafness. Typically 4,000 to 5,000 hertz you can't. Then one more favorite question. Least ototoxic among aminoglycoside is netilmycin. You can remember like this. N for nil ototoxicity, N for netilmycin, least ototoxic. Least ototoxic neuromuscular blocker is tobramycin. Most vestibulotoxic aminoglycoside is streptomycin. Vestibulo is, what is vestibulo? Eighth cranial nerve is called vestibulocochlear nerve. Vestibulo has to do with your semicircular canals, atrial, saccule. You forgot? No. Pakka. It was as tough as doing a normal delivery to deliver ENT into your brain. So you should not miss. We did some ENT part, right? Chandrasekhar sir also taught. Right. So most vestibulo is to do with equilibrium, cochleo to do with hearing. So most vestibulotoxic aminoglycoside, streptomycin. Most cochleotoxic is amikacin, more than kanamycin, more than netilmycin is what you need to remember. Very good to see 15 online classmates. Lux abscess, LUC, lux abscess. Typically, whenever you are having the otitis media, then all these different areas where pus get collected. So mastoiditis and all. Post-auricular abscess, zygomatic bejeweled look. Bejeweled means abscess will gravitate from the medial aspect of mastoid tip into the sheath around the sternocleidomastoid. Whenever you have mastoiditis, 3 named abscesses you should remember. Will you remember? Bejeweled, Sitelli, look. Bejeweled means along the medial aspect of the mastoid to the tip of the sheath of sternocleidomastoid. Sitelli means along posterior belly of digastric muscle. Not diagnostic, digastric. Lux abscess means whenever mastoiditis is there, that pus will gravitate to posterior wall of the external auditory meatus is called look. Bejeweled, Sitelli, look. Bejeweled, Sitelli, look. Whenever you have mastoiditis, right? Definitely one of these 3 will come in ENT. Which one can be premalignant? Rhinitis caseosa. It is also nasal cholesteatoma is called rhinitis caseosa, which can become malignant. You need to rule out malignancy, basically. Which paranasal sinus is mucocele? Frontal sinus. Okay? You'll remember, right? What is the only intrinsic muscle of the larynx that lies outside the laryngeal framework? Cricothyroid. Right? That's what you need to remember. 39-year-old has multiple sclerosis, spasticity. What will happen if she briskly flexes the neck forward? There will be an electrical sensation passing along the spine. What is that sign called? You are there, neurology, multiple sclerosis class or not? Lermit sign. What is it called? Lermit sign. Whenever multiple sclerosis patient flexes the neck, there is electrical sensation along the spine. 39-year-old women with multiple sclerosis is done, right? Then cancer of the tongue. So whenever primary cancer of the tongue is treated with irradiation, prophylactic irradiation of even the neck nodes also need to be done. That is the important principle in cancer of tongue. Tonsils develop from second pharyngeal arch, pouch. Hey, this you did correctly at least. We did in anatomy, right? We did the anatomy revision. So remember, first pharyngeal pouch, eustachian tube, middle ear cavity develop, epithelium. Second, palatine tonsil and the lining of the crypt of the palatine tonsil. Second. From the third, inferior parathyroid gland and thymus develop. From the fourth, superior parathyroid gland and ultimobranchial body, which typically lead to production of calcitonin. What is paradox? I told you. Third is superior, fourth is inferior. Reverse to their English meaning. Will you remember? Killian's dehiscence. In the posterior wall of hypopharynx, there is a triangle area through which there is a herniation which can occur, which is called Killian's dehiscence. Naso-oro junction. What is that mucosal elevation called? Killian is called Passavant's ridge. Okay, naso-oropharynx junction. We'll give a 5-minute break and start. So, doctor, let's continue. 28 weeks pregnant with twins, presents to the emergency. BP is 210 by 135. So obviously, whenever you are having eclampsia, what is the best treatment of eclampsia? Kick the baby out is the principle. So you need to deliver the baby. 23-year-old, 31 weeks gestation, had a domestic violence, and her heart rate is 114, BP 100 by 50. So what is the risk in a full-term gestation female with domestic violence, doctor? Abruptio placentae means sudden premature termination of normally implanted placenta after 20 weeks of gestation is abruptio. Placenta previa means it is abnormally placed placenta closer to cervical os is placenta previa. Right? 23-year-old active labor delivers a full-term infant. There is a jaundice with a bilirubin 14. Probably which drug taken by the mother lead to the kernicterus and jaundice in the baby? Yesterday only we discussed. Albumin is there, doctor. This drug will come, it has a high affinity, it will displace it. Bilirubin, it will displace it out. And we also have shown a table. What are all the various drugs which are protein bound, albumin bound? Sulfonylureas. Very good. Yesterday we discussed now, sulfonylurea will, sulfonamide will kick out the sulfonylurea, warfarin. నేను చెప్పింది వాళ్ళు మర్చిపోతే ఎట్లా తేజ మర్చిపోవడం నా జన్మ హక్కు అన్నాడు బాలగంగాధర్ తిలక్. సో 22-year-old, fever, chills, abdominal pain, vaginal bleeding. Her last menstrual period was 10 weeks ago. Urine is showing beta HCG positive. And cervical motion tenderness is there. There's a tissue seen at internal os. Foul smelling vaginal discharge. That is a classical story of septic abortion. 28-year-old, 1 week of increased vaginal discharge, unpleasant odor, and she is sexually active with one partner, and discharge is showing positive whiff amine test at a pH of 6. And what are these called? Clue cells is what you need to remember. So typically, which is a feature of bacterial vaginosis is what you need to remember. 34-year-old, 40 weeks gestation, ruptured membranes, and fetal heart rate monitoring is done. So what is this which you are seeing on the fetal tachography, doctor? What you are seeing is all right. So it's not safe to. So what is this, doctor? There is a uterine contraction, and the deceleration of the heart rate of the fetus also is very close to the uterine contraction. Such a deceleration is called early deceleration. 3 things you should know, doctor. Early deceleration, variable deceleration, late deceleration. Early deceleration is He, head compression. Variable deceleration is cord compression. Late deceleration is fetal hypoxia. Will you remember? Generally, vice chancellors are all men. Some stupid way to remember. He is man, she is woman. So he, VC, we used to remember. Variable is VC, cord compression. Early deceleration is head compression. Variable deceleration is cord compression. What is left over? Late deceleration is fetal hypoxia. Fetal hypoxia, their fetals will die and it will become late. Late Sri Harishchandra Prasad means he died, no. So late deceleration means you are already late to fetal hypoxia is going to die and it will become late. Don't tell that to the patient. She will kick you. So no further management is required for the head compression. Is what you need to remember. Now, 29-year-old G2P1 who is 35 weeks pregnant, restless, and she says her PG entrance is coming up. She feels overwhelmed with her present pregnancy. At least male doctors preparing for NEETPG has know this kind of problems. Pregnancy is coming. I don't want to carry this pregnancy until I get the NEETPG. She denies feeling depressed but does report that she has a trouble sleeping. And she had an upper respiratory infection last month. And she says that she got it through her son. Already she has a son. So, her thyroid stimulating hormone is very low, free thyroxine is very high. Straight away, why don't we talk about it? That is the cause for all her anxiety. Right? So, hyperthyroidism, propyl thyroidism. 23-year-old, dysmenorrhea, severe right-sided pain, and she is not sexually active, no cervical motion tenderness. See, cervical motion tenderness means pelvic inflammatory disease. What is that called? Chandelier sign. You remember chandelier? Chandelier. So, to a woman who has a severe pelvic inflammatory disease, the cervix will be so tender. If you wear glove and try to put the hand into, she will kick you that you will go and catch chandelier. That's called chandelier sign. No cervical motion tenderness. So this is a case of endometriosis once more. Right, doctor? So her menses occur regularly every 30 days and she requires 5 to 6 pads per day. Right? And that is endometriosis. 39-year-old G1P0 pregnant, present with twins. She has an epigastric pain and feet which are swollen and she has a weight gain of almost 7 kgs. So, she is at risk of developing 39-year-old G1P0 at 32 weeks pregnancy. Eclampsia. So that is the reason you induce the labor because she has a preeclampsia. Eclampsia means seizures plus preeclampsia. Preeclampsia only hypertension. So hypertension, proteinuria is the feature of preeclampsia, induce the labor. 28-year-old woman with chronic hypothyroidism. She recently got married. She and her husband don't want to conceive. Her hypothyroidism well controlled. And she would like to know if she should keep taking her thyroxine. What is your advice? Pregnancy itself can predispose to precipitation of hypothyroidism, which can affect the baby. So that is the reason we want to increase your thyroxine during your pregnancy. That is what you need to tell. A 38-week gestation, 4 kg girl planning for going for Olympics, delivered by a spontaneous vaginal delivery. So, she is limp, cyanotic, lacks respiratory effort, heart rate of 100 per minute, flexes her extremity, grimaces to nasal suctioning. So, you know how to calculate Apgar score, no? So, her 1 minute Apgar score is bad, 5 minute Apgar score is good. So, it is indicated at 1 minute and not at 5 minutes. That is all about the Apgar score. Typically at 1, it was 3. By 5, it is 8. So if the Apgar score is between 0 to 3, you require to do immediate resuscitation. Apgar 8 to 10 means good cardiopulmonary adaptation is what you need to remember. A 26-year-old at 32 weeks of gestation, poor prenatal care, and she denies use of any alcohol or illicit drugs, gained only 8 kgs. Fetus is less than 15% of expected birth weight for that given age. There is symmetrical growth anomalies. So what is the cause of her IUGR? So IUGR, intrauterine growth retardation, can occur because of in utero infection, multiple pregnancies, maternal disease. They're all causes for symmetrical IUGR. Asymmetrical IUGR is commonly due to uteroplacental insufficiency due to maternal hypertension, smoking, poor nutrition. So will you remember this? Cause of symmetrical, asymmetrical IUGR. Asymmetrical IUGR is maternal hypertension, smoking, poor nutrition. Symmetrical is infection, multiple pregnancies, maternal disease. Definitely will come in the tomorrow's exam. 26-year-old obese, mild abdominal pain, vaginal bleeding. Husband is, she is sexually active with her husband, and he uses the condoms all time. Her last menstrual period was 9 weeks ago. She is having an excess facial hair. What is the best next step in management? So, always in a woman of childbearing age presenting with abnormal uterine bleeding, rule out pregnancy. So, get a beta HCG done. Full term 2100 gram means baby was born to a 34-year-old. Her pregnancy was complicated by seizure disorder, inconsistently taking carbamazepine. So now he developed a fleshy sac coming from sacral spine. What is that? Neural tube defect, which can be predisposed by carbamazepine, is what you need to remember. 28-year-old, 30 weeks gestation, 6 hours history of abdominal cramping, right? And contractions are regularly spaced at 15 minutes, increasing in intensity, non-tender abdomen, right? So what you want to do? One of the greatest challenges in managing a pregnancy is premature rupture of membranes, PROM, and that leading to the development of chorioamnionitis. So do speculum, rule out premature rupture, visually access the cervical dilatation and effacement, whether it is good enough to do the inducer labor or not, because she is already how much? 30 weeks gestation, right? 32-year-old presents to the obstetrician, married for 11 years, trying to become pregnant for the past 4 years. It sounds like PG preparation. Passed 4 years ago, trying for the past 3 years, still not be able to qualify and cross 400. Don't worry, you came to right infertility specialist for NEETPG preparation. So we will do a IVF to get your seat guarantee coaching, doctor. Seat guarantee. Good to see Dr. Srinu and many more who are all online. Good to see almost 18 online classmates. Very good. So, doctor, infertility can be caused by male and female factors. So just don't get biased about only women. Always you need to evaluate men also. How is the sperm motility, etc., etc. 52-year-old vaginal bleeding. And 2 days ago, she has some vaginal bleeding that is similar to her prior menses. She states that after a year of hot flashes, irregular cycles, once more vaginal bleeding started. So there is a great risk. Perimenopausal bleeding, whenever it is there, no? You need to follow them up for the possibility of any underlying cervical cancer. Postcoital, postmenopausal. Bleeding always should be looked at, high suspicion. 29-year-old with multiple fleshy growth on the vulva and vagina. And what is this, doctor? Condyloma acuminata, which is caused by human papilloma virus. And what are the high-risk strains among the HPV for cervical cancer? Hot question. 16, 18, 45, 56, you are very hot. Right? So there is a high risk of developing cervical cancer is what you need to remember. 38-year-old G4, P4, obese woman, heavy menstruation, irregular cycles. She's sexually active, monogamous with her partner. Beta HCG is negative. And when you have done the biopsy, what is this? Endometrial carcinoma. And what contributes? The very fact you are obese means you are producing, all your fat is producing high estrogen. High estrogen lead to endometrial hyperplasia, and that lead to endometrial carcinoma. So the body habitus is a predisposing factor. 24-year-old woman presents 9 hours of severe abdominal pain and 4 male sexual partners. Wow. Real lifetime achievement. And involuntary abdominal guarding. So what is she at a great risk, doctor? Pelvic inflammatory disease. Hospitalize, give IV fluids, hydrate. That is what you need to do in this given case, along with antibiotics. 16-year-old postmenopausal woman, vaginal bleeding, pelvic pain, increased urinary frequency, she is sexually active, locally invasive squamous cell carcinoma, which is in stage 1B. What do you want to do? Radical hysterectomy. Right? So what do you do in radical? Uterus and upper portion of the vagina. Then squamous cell carcinomas are all highly responsive to radiation therapy. So you can also give radiation therapy plus chemotherapy is what you need to remember. Wow, very good to see 19 classmates. So doctor, every Sunday, next 6 months, 50 grand tests and a discussion will be followed. So please download the SCORE app. Please be part of our WhatsApp study group. You have the link below. we'll have discussion. And every day we have 3 hours of live discussion of high yield facts, and we give you 1500 pages containing 54,000 high yield facts. If you are there in our WhatsApp group, morning, evening, night, midnight, early morning also, we don't let you sleep. We keep punching you the quiz questions and keep answering. Be in that excitement of preparation that is all about winning and losing the NEETPG. And also, you have 30,000 MCQs to play with the chatbot on the Score app. So today only download the Score app, be part of our WhatsApp group. And if you want 1500 pages, we will courier to your home, and you can message us on the WhatsApp group that you like to be part of the coaching subscription, where you get 30,000 MCQs on Score app, 50 full-scale grand tests with discussion on every Sunday, and 1,500 pages with 54,000 high-yield facts notes, courier to your home, along with 600 hours of video lecture of our daily class, available on both Score app and onlinembbs.com. And more than that, if you feel you already have a lot of videos and everything, you don't need, still be part of our guests on the daily YouTube live session, right, doctor? And your studying along with you is the greatest reward, more than the fee that you pay, right? But ultimately, what is needed? You need a study mate, roommate, benchmate, like Dr. Murali Bharadwaz, who will teach you today and you will forget it tomorrow, right? No problem. We will make you learn. Come on, quickly tell. Where do you see bamboo spine? Teja? Ankylosing spondylitis. Where do you see ivory vertebra? Not ankylosing. Pages. Where do you see osteoporosis circumscripta, wool-like skull? Pages. Where do you see picture frame vertebra? Pages. Where do you see blade of grass sign? Pages. So we are going to push those high yield facts and study every day with you. Right, doctor? So last 7 questions of the today's marathon, we had been laboring for the past 3.5 hours. Wow. Did I not make you sleepy, Teja, today? No? Wow, I achieved it. So, good. 32-year-old, after discovering a mass on the breast self-examination, it is 2.5 centimeter fluctuant mass. So, doctor, what is her age? 32-year-old. 32-year, unlikely to develop breast cancer. So that is the reason. What is the management? Do FNAC. Which benign tumor is called breast mouse fibroadenoma? Very good. That's the reason if any patient is having fibroadenoma, no, you don't search her breast and fondle it. You ask, Amma, I am to a very young Shankaracharya who became student, and you are like Lord Saraswati, right? So please show me your own mass, right? So that is what you need to ask. So, doctor, 34-year-old, G0 woman, she was sexually active with 4 partners, treated for gonorrhea once in the past. Pap smear is showing low-grade squamous intraepithelial lesion. What do you want to do? Always, we studied no. HSIL, high-grade squamous intraepithelial lesion, LSIL, low-grade squamous intraepithelial lesions in the cervical cancer when you do PAP. So if PAP is suspicious, then you do colposcopy and do a colposcopic biopsy. Breast examination, a 32-year-old, firm 2 centimeter mass in the right breast. It is mobile and non-tender. Solid, well circumscribed mass, found to be benign. So, what is the story? This is a fibroadenoma, classically. Fibroadenomas are slow growing, most common mass in the breast tissue. Hormonally dependent, if pregnancy is there, high estrogen is there, fibroadenoma also will grow in pregnancy, in size. 56-year-old postmenopausal women, advanced ovarian cancer, and CT shows extensive disease extending from her left ovary and involving large pelvic nodes. What is the best treatment? Surgical debulking, and post-surgically give paclitaxel and cisplatin therapy. Right? Between chemotherapy and surgery, always the choice. Generally, chemotherapy in ovarian cancer is more effective when the tumor masses are less than 1 centimeter. More than that means you need to do tumor debulking, is what you need to remember, and post-operative chemotherapy. 34-year-old healthy woman, 3 weeks of history, severe flu-like illness, and submandibular and cervical lymphadenopathy. Multiple sexual partners. And what is this lesion you are able to see, doctor? Chancre. Right? So it is typically a syphilitic chancre. Right? And if you don't treat it in the next stage, it will lead to the development of the gamma. Gammas are the granulomatous lesions that necrose and become fibrotic. Skin gammas, bone gammas, anything can happen. 21-year-old, burning sensation while urinating, no peritoneal signs, but suprapubic area, tenderness is there. Urine sample is showing a lot of WBCs. So basically, burning sensation is more a feature if the urethra is involved. Cystitis is there means most of the time suprapubic tenderness is the presentation. So, chlamydia leading to UTI is very common in among the sexually transmitted organisms. She is recently having a new sexual partner, no, in the history. That is a very important clue, doctor. Okay? Now, 25-year-old, about 6 months pregnant, her first child presents for the first time to an obstetrician, and she is taking a medicine for depression, found to be lithium. Now she became pregnant while taking lithium. What will lithium lead to? Epstein's anomaly. That's the reason you need to do fetal echocardiography. 34-year-old, uterine fibroids. Which type of fibroid will interfere with conception, doctor? Submucosal fibroid. This is called reaching to the top of Everest. Many times we were feeling how to do 200 questions revision. But we did not lose our willpower, doctor. For the past 3 hours, 35 minutes, we are laboring. I really appreciate Dr. Shaw Valaise for the kind of energy. Right? Good. And also Teja. Generally, I make Teja to sleep. But today I made him alert. Right? And told him, kernicterus is caused by the mother taking which drug, doctor? Sulfur? Nemide. Good. So today we are really missing Varsha, Monica, Girija, and all our regular gang mates. No problem. Tomorrow we'll sit for 3 hours and finish the antibiotics topic of pharmacology. Sure, short one question will come, right? 24-year-old painful genital rash. So basically, this is what doctor, vesicular rash on the vulva, which is very typical of herpes lesions on the vulva. She denies any vaginal pruritus, that means trichomonas, blah, 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 is gone. So your diagnosis is herpes on the vulva. Bellacyclovir is the treatment of choice to treat both primary and recurrent episodes of genital herpes. Shanti, Shanti, Shanti. So tomorrow you're all coming, both online students and offline. So every day we keep studying all the day. Depression leads to pseudo dementia. The only way to not feel depressed or stressed out to your PG preparation is to study. You take famous politicians. If there is any CBI case on them, CBI is behind them. Typically, they go to the public meetings and conduct a public, all public is there around, means CBI cannot come and catch. NEET PG preparation is also like, there's going to be a CBI ride. And the best way is study, 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 and be part of our WhatsApp study group. Right, doctor? So thank you very much.